us where Johannesburg is divided into some.
The chief is on the phone, Deputy Chair. Deputy Chairperson?
Yeah.
Minister has asked for 2 minutes. She says she's joining us in 2 minutes. Our apology.
This meeting has been convened by me as Chief Justice in terms of Section 51(1) of the Constitution of the Republic of South Africa. In terms of Section 51(1) of the Constitution of the Republic of South Africa. In terms of Section 51(1) of the Constitution of the Republic of South Africa. In terms of Section 51(1)
Is the chief whip on? Is it on?
Of the Republic of South Africa.
Not yet, Deputy Chairperson.
Okay. I don't know what to do
In terms of
because
Section
I will need them to be here.
51(1)
Is the chief whip on, Honorable Nyambi?
Honorable Nyambi is here, Deputy Chairperson, and the Chairperson is here, and Honorable Ngwenya is here. No, not here, Deputy Chairperson.
Okay. I don't know what to do.
In terms of
Because there is the minister, I will need not yet be there.
51
Is it Chief Whip and
Minister
Honorable
is not
Nyambi?
yet here, but Deputy Minister is here, he's on the platform. Deputy Minister Maule is on the platform.
But it's not the issue is that who is going to do the presentation. Because if we know, we can possibly start. But if the minister is doing the presentation herself, then we will have to give her some 5 minutes more
Yes,
before we going to start.
that's correct, Deputy Chairperson. She's doing it herself.
Okay. So.
Deputy Chair, this is Honorable Labuskani. Is there an, can anyone give us an indication how long the minister will still be? Because, yeah.
No, what I just said to Zamadem, we are going to give her about 5 minutes more before we are going to start with the meeting. Apparently, the minister is doing the presentation herself, which means we will have to just be a little bit patient. Yes, I'm listening.
We can start with the Chairperson's input. Minister has joined us.
Thank you. I thought as much. I think we can. Yeah. Thank you very much, honorable members. We have started on this trend for some time now by inviting the ministers to understand better the issues of the action that is taking within the COVID pandemic and within trying to slowly normalize society in terms of the areas that we need to address to make sure that we get back to a normal society where we can begin to slowly but surely make citizens to become active again. And one of the areas that is very important is the area of education and also the smooth return of our children to schools, our students to institution of learning. It is something that has become very important for us at this moment. So as the NCOP, and particularly with our distinct responsibility, it is important that from time to time we need to make sure that our provinces, as well as the local sphere of government and our communities, actually understand in terms of our oversight responsibility, how we are going to assist them also to get clarity on the issues of slowly making sure that the communities or society is becoming totally normal again. So with this said and done, we will just request that honorable members, for our own sakes and for the sake of getting order in this house, we observe a moment of silent prayer. Thank you very much, even for those that have observed more than a moment, particularly in the times of COVID-19, that we so much need divine intervention at this point of time. So without much further ado, we will start the meeting, and the chairperson is going to do the welcoming address. So allow me thus to welcome the chairperson, the Honorable Amos Masondo, sorry Brambi, to do the opening and welcome. Thank you.
Thank you very much, Deputy Chairperson, Honorable Minister of Basic Education and MECs, and the Deputy Minister, Honorable Premiers, if any are present, Honorable MECs for Education, Honorable House Chairpersons, Honorable Chief Whip, Honorable Permanent and Special Delegates, ladies and gentlemen, Dumela. Today, we've woken up to the news that the global cases of COVID-19 now stands at 9.5 million people. The death rate is above 400,000, and the Republic of South Africa, or South African figures, stands at 111,796 and 2,205 respectively. Program Director, our meeting this afternoon takes place at a time when projections by experts on infections and mortality models suggest we are nearing the peak in the spread and impact of coronavirus. This is indeed evidenced by the growing number of confirmed cases across the country. The most disturbing, of course, being the situation in the Western Cape, which has about half the number of confirmed cases. Earlier this week, the World Health Organization, WHO, correctly articulated the fact that the fight against the coronavirus pandemic is not a choice between lives and livelihoods, but that we must do and grapple with both. As such, who urge countries to be careful and be creative in finding solutions that enables people to stay safe while getting on with their lives. All countries must double down on the fundamental public health measures that we know work, which are finding and testing suspected cases, isolating and caring for the sick, tracing and quarantining contacts, and protection of health workers. The World Health Organization view, which we share, is that these measures could only be effective if each and every individual takes the measures that we also know work to protect themselves and others. These are, amongst others, maintaining physical distance, washing and cleaning our hands regularly, and wearing a mask where appropriate to protect oneself as well as others. Research shows the effectiveness of these measures. For example, a study by a team of researchers in the United States released this month, which examined the chances of COVID-19 infections, have found that not wearing a face mask dramatically increases a person's chance of being infected by COVID-19 virus. They found that using a face mask reduced the number of infections by more than 78,000 in Italy from April 6 to May 9, and by 66,000 in New York from April 17 to May 9. As part of our responsibility to protect both lives and livelihoods, the regulations for alert level 3, published by government last month, provide for all persons who are able to work from home to do so. However, persons will be permitted to perform any type of work outside of the home and to travel to and from work for work purposes. subject, amongst others, to strict compliance with health protocols and social distancing measures, the return to work being phased in, and the return to work being done in a manner that avoids and reduces risks of infection. We thus urge everyone during this period, which involves the easing of restrictions, to continue adhering to the safety protocols. One of the critical tasks as we face the new normal is the reopening of schools. For this intervention, we salute the minister and his team for their courage and for their insight. We note the measures to address, prevent, and combat the spread of COVID-19 in the National Department of Basic Education, all provincial departments of education, all education district offices, and all schools in the Republic of South Africa. The directions are in accordance with the regulations made under the Disaster Management Act of 2002 in response to the coronavirus pandemic. They help us to understand the arrangements for a phased return of educators, officials, and learners to schools, to hostels, and to offices, as well as compliance obligations and service standards. Program Director, Parliament's oversight role entails, amongst others, the scrutiny of the implementation of laws, the application of the budgets, and the strict observance of statutes and the Constitution. Following the declaration of the state of disaster in terms of the Disaster Management Act by the President in March this year, Parliament has had countless interactions with members of the executive in respect of the implementation of the Act. These were in the form of committee meetings, plenary debates, and questions. In addition to these, the NCOP also arranged special briefings by the Department of Cooperative Governance and Traditional Affairs, Health, and now Basic Education, to understand the coordination of efforts by the three spheres of government in the implementation of the Act. The overall responsibility of the NCOP in relation to oversight is to ensure an integrated oversight approach that contributes to integrated development. We have organized this session in order to understand the progress made on measures to manage the impact and spread of COVID-19 pandemic in schools. It is of critical importance to us as the delegates to the National Council of Provinces to have the necessary information to scrutinize the effectiveness of coordination and cooperation among the spheres of government. Chapter 3 of the Constitution enjoins all the spheres of government and all organs of state within each sphere to, amongst others, cooperate with one another and coordinate their actions. We thus have the obligation to oversee adherence to these constitutional principles of cooperative government. With these few words, Deputy Chair, it is my pleasure to welcome all of the participants and delegates at this important briefing session. Namgelegi. Thank you very much.
Thank you very much, Honorable Chairperson. And with that said and done, we want all of you to focus now on the presentation that will be done by the Department of Basic Education in the person of the Honorable Minister, and we hope the Minister have connected successfully. We will now give over to Honorable Minister Angie Motshekga.
No, thank you very much, Chair. Let me also give my greetings to yourself, the chairperson of the NCOP and members of the NCOP and honorable guests from different provinces. Chair, let's thank the opportunity that we have been given by the NCOP to update the nation and yourselves on the measures we have taken and the progress we have made since the reopening of schools. As the chair will be aware that we had initially planned to open or to start effectively teaching from the 8th of June, but from the 1st of June, but unfortunately, because of a number of challenges that we had, we could only start effectively teaching from the 8th of June in the majority of schools. And upfront, I have to say, Chair, there were schools that we were unable to operate from the 8th of June for a number of reasons. More than 2,000 of our schools were vandalized during the lockdown, and we had to find resources and service providers to fix those schools. There were other schools also we were unable to operationalize, where we just had insecure water and sanitation to safely open those schools. So what we did then was, from the 8th, the number of schools that we could not be open have been reduced. For instance, in Gauteng, there had been 5. When we met on Monday, they said they're only left with 5 schools that they're still repairing. But what we had then instructed our provinces to do was to say to them, no child should be left behind. Therefore, schools that we could not operationalize, the provinces have to find alternative schools for them. And Chair, I really say we're very grateful that we have this opportunity, because we really have to state up front that the decision to open schools was not taken very lightly, and therefore fully appreciate the anxiety and the tensions that came with it. But we also felt that it was very important that the schools should start and operate. So the anxieties that came with it are fully understood and fully appreciated. Honorable members, we were driven by an understanding and guidance that we got from the health department, from the National Joint Team, but also from international trends around schooling in COVID-19 environment. Honorable members, international evidence informed us, and international agencies, amongst others, supported the decision to open. UNESCO, UNICEF, and World Foundation says COVID-19 pandemic presents an unprecedented risk to the children's education, to their protection and their well-being. It is now established that disruptions to instructional time in the classroom can have a severe impact on the child's ability to learn at a later stage. And it even gets worse amongst the poor. The different agencies guided us to say the longer the marginalized children are out of school, the less likely they are to return. Earlier research, Chair, confirmed that children from the poorest households are already almost 5 times more likely to be out of school than those from the richest. And I can confirm this trend, Chair, from also the statistics of attendance that we've been collecting. Whilst in affluent schools that serve affluent communities, the attendance rate is almost 99.8%. We are still short of children in informal settlements, in poorer communities and in rural areas that we have to trace back and make sure that we can stop the risk of them dropping out, because that was our biggest fear. And it has been confirmed even by attendance rates that are there amongst the poor and the affluent communities. So we still feel that we're correct to save our children by taking them early in schools. And I really have to say again, Chair, it was not a decision that we took lightly, but we felt it was a very important decision. So we have been requested to say, what are the things that we have done to manage and make sure that we can protect our children. So when we made a request to cabinet to allow us to open schools, the president and cabinet were very clear that safety comes first and the salvaging of the year is dependent on safety measures that have to be put in place. And that was a condition that we were given. So we had to take all the necessary steps, all the necessary precautionary measures to make sure that indeed we can protect our children. And I'm happy that Chair in his opening remarks did refer to some of the points that we did. For instance, we have made a commitment to provide every child in our schools with 2 cloth masks for the year. We have made sure that all our schools were cleaned before the opening. We have instructed all our schools to make what we call physical distancing of about 1.5 meters away from each other. And even have markings in the schools to make sure that indeed our children are social distancing. We have trained our teachers, our senior people, and all the members in our institutions on COVID-19 and orientated them. Schools were instructed, even our offices were instructed to have what we call the COVID-19 files, which contain all the documents, all the protocols which have to be followed. And we have made it our business as the sector to drop everything but to monitor that indeed those hygienic measures are put in place, which the chair had raised, the wearing of masks at all times, the washing of hands. We have provided soaps to make sure that there's sanitizers in all our schools and make sure that there's social distancing. But more than anything, to continuously educate our children around COVID-19. And all schools, as I said before opening, they were thoroughly cleaned, and there are instructions that they have to be cleaned on a daily basis. Chair, even if you could visit our schools up to now, you will not be able to enter the gate without screening. And after screening, following the health protocols, then if you present a high temperature, you are taken to an isolation room. All schools have isolation rooms. You are given a mask, and the health department takes over when you present a high temperature or any of the symptoms that we've trained our people. So as we say, we did give instructions to all provinces that no school can be opened until it meets the minimum COVID-19 standards, which essentially mean the basic sanitation and hygienic package. All essential staff has been trained on the new COVID-19 orientation, on the management and the combating of the pandemic, using the sanitation and hygienic measures. And these measures include cleaning and disinfecting materials, the provision of your personal protective equipment, the provision of sanitizers, alcohol with 70% minimum alcohol, hand washing, and hence water became a major issue that affected our schools opening. But it also meant on our side, which was a big challenge in the beginning, the availability of water and sanitation facilities, which again, I have to say, Chair, it's not as if there was zero water in our schools, but there was inadequate water for us to safely say the schools will be protected. So in partnership, we had to partner with Stretch in terms of meeting our COVID-19 demands. We had to partner with the Department of Water and Sanitation. We had to partner with Development Bank of South Africa, with the Mvula Trust, and more importantly, with the South African National Defence Force to ensure that schools needing emergency water and sanitation are being prioritized and are being attended to. Every school had to have a full-time screener who, even before you enter the premises of the schools, you are, as I said earlier, you are fully screened and the health protocols kick in if indeed you present a high. All our food handlers were also trained and provided with the COVID-19 essentials, which again included masks, gloves, disposable aprons, aprons, and we have also provided these handlers with food cleaning and sanitation material to make sure also that even in our food serving areas, all the protocols are being followed. En route to schools again, all the operators of the transport employed by the department, we have made sure that they follow the Department of Transport's protocols. They are provided with adequate sanitizers and other hygiene dispensers, and also we monitor, and there are transport monitors to ensure that they adhere to the newly published loading capacity guidelines. Again, as I said earlier, Chair, there are other measures which have been prescribed by the Health Department with the National Command Center about social distancing. And again, as I said, we have made sure that in our schools, there are markings, the seating and everything else complies in terms of the guidelines that we were given about social distancing. I can say, Chair, for the first phase, as much as it was difficult to enable the system to really be COVID-19 compliant, because we're taking even fewer learners for the first time, but it was not easy. We only took 2 grades, grade 12 and grade 7. And because it was those small grades, it was much more easier to do social distancing. And we will be receiving another cohort of learners from the 7th of July, which in terms of our estimation will fill cohorts will not be able to find spaces in our schools through social distancing. And working with our provinces, both provincial departments and even our partners, we're looking at what alternative measures we should put in place, including rotational teaching, where learners will come in the morning and then we clean the place. The next cohort comes 2 hours later. And I see the chairperson is laughing. During our generation, that used to be the norm of platooning. So we will also go back to the platooning because of the challenge. We're in the same school with the chair, so that's why we know the platooning system. We also are looking at how we can increase our capacity. We are working with Treasury to see if we can find additional resources, because as a department, we've been completely overstretched with resources, but we are also hopeful that we'll be assisted from the discussions that we have. The other challenge that has been confronting us and which we're dealing with the Department of Health is around the comorbidities. There's lots of misunderstanding about the resolution that we've had with Labour at the Labour Council. We have quite a big number of teachers who have declared comorbidities, and the rules are saying it's the doctor which has to declare if you can stay. You can't decide that you are 60, you are hypertensive, you also have diabetes, but it's the doctor which has to say your diabetes is controlled, therefore you have to go back to work. So that's one gray area we're still sorting out, and we hope that before we get to the second phase, we will have resolved it. We've also put a package in place, Chair, for learners who are at risk, especially learners who really have underlying problems. The doctors feel it's not safe for them to go to the schools, and different provinces and different schools are putting measures in place to make sure that they're not left behind. In terms of the grade 12s, which we had indicated from the word go that the papers are already set, and as the chair said, you don't want a class of 2020 whose matric is doubtful. You would rather write later rather than write less, because you want the matric certificate to have the same credibility and to have the same currency like any other matric certificate. And on that spot, we're not compromising, and therefore are saying the grade 12s who are going to be writing an exam which has been set before COVID-19 are going to write it under the COVID-19 environment. So we have moved the exams from starting in October, that our exams will start in November. A month later, provinces are putting a number of measures to make sure that indeed our learners are being assisted to complete the curriculum. For the internal grades, Chair, We have also made sure that we trim down the curriculum. We will then link up the 2020 year to 2021 so that some of the topics will be moved to the next phase, to the next year, so that they don't miss out on anything that they are supposed to have learned. But we make sure that we salvage that which we can salvage for this year and really renegotiate the curriculum for 2020 to make up for the losses that we have in 2020. And that has been developed and finalized, and it has been done with provinces. Chair, we're also quite aware that the virus COVID-19 has created lots of anxiety and stress for learners and teachers equally. We have put in place in different provinces. For instance, if a colleague that was sitting with you yesterday gets the results that they have tested positive, the psychological devastation that comes with. So there are measures to support both schools, both teachers, and all other people who have been around. But the main defense that we said, as the chair had said, that even if a person would have been tested or confirmed as positive, if the other measures had been put in place, people have been wearing a mask, they've been social distancing, they've been washing hands, they are much more safer, even if they were in contact with a person who is not, who has been infected. So we have the basic guidelines for SSA for screening. For the 7th intake, we will now be taking children from special schools. We have been under pressure to really make sure that we do open up schools, special schools. Well, some of the special schools, Chair, are not only schools per se where there's tuition, but they're also therapeutic centers. And if they stay too long at home, it also has impact on their health under general. So that's why we had to make sure that in this next cohort, special schools are also allowed to open, and we're working with them to make sure that we can follow appropriate protocols for those kinds of schools. Because schools for children who are blind will be quite different because you can't social distance. Therefore, you have to be holding hands. And what is it that you do to make sure that they are also safe and our teachers are safe? So we've been working with the special school sector to work on the protocols suitable for that center. We are also working, because we are quite aware that we are dealing with a very difficult environment. We're working quite close with our parents, your SGBs, to make sure that they provide the necessary support. And I can say with humility, Chair, that we've been receiving amazing support from communities. We've been getting lots of support, as much as our schools were being vandalized. But I can tell you to protect their schools. We have instances where, for instance, even parents took turns to sleep in the schools to protect their children. So it's not very true. It's not actually very accurate to say communities have been vandalized. It's just a group of bandits who have been attacking schools, and communities themselves have been doing a lot of work to protect their schools. There have been lots of community arrests, and in some incidents, there were even incidents where people who were attacking schools were killed by communities, and we have requested them not to take law into their hands. So it's a very difficult situation, because in some instances, it's not just stealing, coming to steal in schools. Yesterday, I got pictures from the fifth day. Somebody would have come, I think, with a hammer to break all our toilets and just leave them on the ground. So it was not any crime driven, but we still don't understand what would have happened. But we're extremely grateful to our parents and our communities for helping us to clean schools, but also for protecting them against this scourge that is there of attacking schools. We've worked very well with our principals, councils who are, because schools are carried by principals, and our South African Principals Association has been very helpful in guiding us and making sure that things are in place, even where there were weaknesses on the part of government. Principals and SGPs have stepped in to assist us. We've had lots of support with teacher unions. in the beginning, and rightfully so, there were concerns on their sides that we really were not protecting their members adequately. But I can say, Chair, with confidence, they have been supporting us to make sure that indeed we are ready for the schools. We have, as I say, a plan in place for learners at risk. We are following, if you go to our website, there are a number of standard operating procedures that we have put in place for every other activity that has to happen in our schools. And we really humbly appeal, because schools serve the most important asset in our country. And that's why I also had this banner to say every child is a national asset. So we really fully appreciate and acknowledge the fact that children are the most important assets in communities and in homes. But it's also very important to make sure that we contain unnecessary anxiety and panic in the sector. How we handle break-ups in schools, it's exactly the same protocols which have been established elsewhere. If in Parliament there are 10 staffers who are not, who have tested positive, you treat the schools the same way that you will treat it, to say what is the tracing, what are the tracing measures to be put in place, what are the follow-ups, what do we need to do, because for all the steps that we have to take as department are steps which have been prescribed by health. And if we get to a situation where there is indeed a big number of learners who test or teachers who test positive, the Department of Health has been very efficient in quickly coming into the situation and managing the environment. So Chair, I don't want to take your time, but I really want to assure you and the provinces that working together with our provinces, we're doing all we can within our powers to make sure that we continue to have effective teaching, but more important, we protect our learners and teachers and make sure that our schools don't become places where people get infected or where the outbreak happens, but they become places where we detect problems before they start. Because the very people that have been tested positive in our schools are people that we've screened at the entrance in the past weeks, that through the screening process, they would have been identified with all the symptoms and sent to the Department of Health. And surely if they had not been screened at schools, it might, maybe in some instances, have been too late for them to receive the necessary attention. So thank you very much, Chair. We will welcome the questions, but thanks for the opportunity to really to speak to this matter. And I can surely say, Chair, in the past 14 days of schools reopening, we've had more than 98% attendance in our schools. So which means our parents trust what we are doing, but more important, our parents have stepped up to work with us to make sure that their children are protected. So we had very amazing turnout, and we're already looking at what the 2% is and working with parents to make sure that their children don't drop out. But if there are genuine reasons why they can't come to school, how we assist them and support them at their homes. Thank you very much.
Thank you very much, Honorable Minister. Honorable members, the time the Minister actually assisted a lot. She saved us a lot of time. So we will at least use about as much time as we need and make up for the, but at the current moment we are within our time. So we will now request that those that want to ask any questions, use the function of raise your hand on participants, and we will then allow you to ask questions. Immediately we will start with Honorable Bibi, and then it will be Honorable Christians, and then it will be Honorable Hassan, and then it will be Honorable Pataway. I will go up to Honorable Pataway, and from there then the others will be identified. Honorable Bibi.
Okay, thank you very much, Chair. Greetings to the Minister and her deputy, and also our special delegates, and especially from my province, KZN. I greet you all, even with you, comrades, and also colleagues of the NCOP. My questions, I've got just few questions. The first one will be in the King Kochayo and Umkhanyakuti district in KZN. There were cases of water at schools that were shared with communities. Has the situation improved or not? If no, why not? The second question, Honorable Minister, will be, we had our Minister of Finance yesterday tabling the supplementary budget. And he mentioned that 5 billion of education catch-up plan for schools. The question will be, is it possible for the rural schools to get the big chunk of that allocation given their historical background? And the third question will be, my province, KZN, KwaZulu-Natal, is finding it difficult to accommodate more grades without additional funding due to challenges of infrastructure, which are making it difficult to ensure social distancing. And there are a number of schools that still need additional mobile classrooms. The province needs at least 1 billion to fix the challenge of education. Can the minister pursue the National Treasury to rescue KwaZulu-Natal with more fundings? And the last one, Chair, it will be, what is the percentage of school attendance of both teachers and learners in provinces? And what are the figures of the teachers and learners with comorbidities? Thank you, Chairperson.
Thank you, Honorable Bibi. Honorable Christians.
Thank you very much, Chairperson. My question to the Minister is about the poor quality of our school water tanks that were delivered. Now, Chairperson, we understand from the reply that Minister Motshega has given that the tender was awarded to Rand Water due to their proven track record of delivering huge projects within a short space of time. However, the delivery of the water tanks to our schools have been marred by non-delivery and products of inferior quality, where it has even been reported that some water tanks have collapsed when filled with water. This inability to deliver quality water tanks on time has actively endangered the lives of both staff and students. We would like an indication as to how many water tanks were delivered, whether a department will provide a list of all the schools where they were delivered, and what steps will be taken to ensure that delivery takes place as a matter of urgency, especially considering that our next cohort of learners will be returning to school very soon. Does Rand Water have the capacity then to deliver on time? My next question is regarding the tender for the 32-inch TVs. Now, regarding the publishing of a new tender for 100,000 locally manufactured 32-inch TVs for grade 12 learners who receive social grants, has the bid been withdrawn? And if so, why? Or has a new bid been published? Why has government allocated funds for this procurement as opposed to using funding to rather increase access to the internet across the country, where many schools have poor or non-existent access to the internet? Wouldn't it have been better to allocate laptops with router devices for students, as that would have been more sustainable to our learners in the long term? Thank you very much, Deputy Chairperson.
Thank you, Honorable Christians. Honorable Hassan.
Thank you, Deputy Chair. Honorable Hassan, representing Gauteng as a special delegate. Two short questions to the Minister. The first is, Minister, you spoke of screeners at the entrance to our schools. Is this similar to the COVID youth brigades that we've implemented in Gauteng, or are you utilizing existing staff? The reason I mention this really is because it's an opportunity to upskill and train young people in particular and provide some form of employment opportunity opportunities, especially at a time where we see the youth unemployment rate being particularly high? And my second question, Chairperson, is whether there's been already an update on the engagement with learners. They're fundamental, if not the most important stakeholder. And given the fact that we're returning to grades, or we're returning other grades rather to schools, what has been an update on that? And for me, it's not just around the formalized youth structures. Are we engaging young people on the ground, both inside and outside of COSAS? Thanks, Chair.
Thank you, Honorable Hassan. Honorable Mariette Patoy.
Thank you, Honorable Chair, and I'm a special delegate from the Free State. My question to the Minister is around remote schooling for students with comorbidities. Learners and teachers with comorbidities cannot attend schools until it's medically safe. The Minister has indicated that there is a plan in place to arrange for remote teaching and learning where teachers, either teachers or learners, cannot physically attend school. However, not all learners with comorbidities have the financial or technical assistance for remote schooling. Is there a national plan in place to ensure that no child is left behind just because it is not safe for them to attend school during this time? Additionally, are teachers with comorbidities equipped with the necessary hardware and software to teach from home?
Finished. Thank you, Honorable Ms. H.S. Bosov. Honorable Bosov.
Thank you very much, Deputy Chair, and good afternoon to our Minister. Minister, due to the repercussions of COVID-19 and seeing that parents have been unable to pay school fees, this has affected both public and private schools. There's an expectation that unemployment will also be on the rise, and we could see between 3 to 7 million people being added to the unemployment rate. In view of this, does the Department of Education have sufficient provisions at public schools for learners who might be affected at these private schools? Is there any indication as to how many public and private schools have been financially affected by the loss of income? And Chair, my second question, please, is with regard for educators in the SGB posts. It could have a devastating effect on education as a whole, as many of these schools will have to resort to either laying these educators off or adapting their employment agreement in that their salaries may be minimized by half. Have engagements taken place with your department, Minister, to see what amicable agreement can be reached to assist these schools to retain SGB appointees? And how will a shortage of teachers cope once more learners return to school? If not, why not? If so, what are the relevant details? Thank you.
Thank you. We will continue with the questions so that when the Minister responds, it can be a comprehensive response. Honorable Nomsa Marchesi. Nomsa Tarabella Marchesi.
Okay, thank you, Chair. I'm a special delegate from the National Assembly. I'm not sure if I'm given an opportunity. I raised my hand, but I wasn't sure if I'll be given an opportunity. Should I take it, or maybe I should leave it for your members to take that opportunity?
Can we give this, particularly the special delegates, an opportunity, because from National Assembly we always have opportunities, if you agree with me. Thank you, dear. Can we then give Honorable Arnolds? Arnolds.
Thank you. Thank you, Chairperson. And greetings also to the Minister, and then also to all the members of the NCOP, and then also other delegates. Chairperson, I think let me just say first condolences to all the family members that have lost family members due to COVID-19. We send condolences to those family members, and also especially also here in the Western Cape, where teachers have died due to COVID-19. Minister, in the Western Cape, you must look at the Western Cape. The reality is that currently the Western Cape accounts just over half of these the reported COVID-19 cases. And according to the World Health Organization recommendations that the lockdown only be eased once the country saw a decline in the number of new cases. And I think if we look at the Western Cape, the current status of the Western Cape, then something needs to be done. There needs to be an intervention. My first question to you is, because we know in the health department or the health facilities, if a patient died due to negligence, then people can sue the Department of Health. Now, in terms of the current infections at schools, and then also when there is death in schools due to COVID-19, can parents sue the Department of Education for negligence? Then the other question is, how do you want to run an academic year in a year that will be severely disrupted by COVID-19 cases in schools, especially now during the peak season in the month of September? It doesn't make sense that you're gonna have disruptions every time in schools, and just to continue with the running and the opening of schools. In the Western Cape is one of the examples that I can mention. In the Noon, a high school that was closed and then reopened, closed and reopened. You cannot run a school, you cannot run education with disrupting the curriculum. So it won't be effective and it won't work. Then the other thing is, in the Western Cape, we don't only have a health pandemic in terms of COVID-19. There's other health-related diseases or sickness here in the Western Cape, especially in Cape Town. If you look at asthma, for example, that is also having an impact on children and families. So it doesn't make sense in the Western Cape to just continue with business as usual. Thank you, Chairperson.
Just because the phone was ringing there, honorable members, this is to say an extended committee of, or an extended meeting of the House and the committees. Can we please observe the same rules that is usually being observed? So, Honorable Ngwenya, you will be the next one. Honorable Ngwenya.
Thank you, Deputy Chair. Chairperson, I've got a few questions. Thank you, Minister, for the presentation. Any school in Gauteng that are closed due to infrastructure issues specifically, those that have challenges of water supply and pollution facilities, as well as those affected by the positive cases of COVID-19? If yes, how many schools are closed in Gauteng, and which district are those schools located at? The second question, Chairperson, the school that are closed or did not open at all due to infrastructure challenges and COVID-19, are there any alternative arrangement that were made to refer learning to other schools to get learning and teaching? The third one, Chair, how many cases of theft, as the minister talked about the vandalizing of the schools, that have been reported to police station, and are there any arrest of suspect like to theft and vandalize of schools? Lastly, Chair, what is the plan of the department to assist schools that cannot afford to employ securities and all to keep the properties of the schools secured, particularly the COVID-19 incentive? Thank you very much, Chairperson.
Thank you, Honorable Ngwenya. Honorable Moima. Moima. Honorable Moima. Honorable Moima. Honorable Dangor. Honorable Dangor.
Thank you very much, Chairperson. Minister, we visited about 31 schools during the period, and all of them comply with the regulations. However, the headmasters and other staff members have expressed a concern about transport. Some of the students and learners travel 40 kilometers by taxi, and they're not too sure of those taxis observing the protocols when transporting students. Thank you very much, Minister.
Thank you, Honorable Dangor. Honorable Moritsane.
Thank you, Chairperson. I've heard the minister talking about the percentage of learners attendance, that it was around 98%. But I didn't hear the minister saying anything about the infections percentage in schools. So I would like that if the minister can come up with just to highlight and say, so far, the percentage in terms of infections in schools, it is how far it is. Second question, Chairperson. On the news of SABC today, it has been highlighted that the private schools are making parents to sign the agreement that schools won't be sued for their children for testing COVID-19. Now, I want to understand from the minister, what is their intake, their role in terms of protecting that parents? Because I don't think that it is fair for those schools to say that the parents must sign the letters that says that they won't sue the school if their children are infected. Thank you very much.
Thank you, Honorable Moletsana. Honorable Ntsube. Honorable Ntsube.
Thanks, Deputy Chairperson. Let me pass my greetings to the Minister. I think I'm highly covered by the previous speakers who spoke before. But however, I have just a few questions that I would like to pose here. I wanted to check if the Department of Education have enough time to cover up what has lost due to COVID-19 to prepare the learners to write for the examination. And secondly, there are mounting pressure from COSAS and SADU calling for government to shut down the schools. According to COSAS and SADU, they're saying that it was too early, too soon to reopen school. I wanted to check with the minister if does she think that was it not too early, too soon to reopen the schools, and that can she consider if the Department of Education and government can maybe cancel or scrap the academic year of 2020, and then the remaining time of this year, they may focus on the curriculum of South Africa, on the education system of South Africa in general, because it has not been productive. Thank you very much, Deputy Speaker.
Yes, we are left with 5 more questions, and I think let us allow them. We will then give them. It's Honorable Nita, followed by Klute, followed by Luchuli, followed by Gillian, followed by Baha. Baha will be the last one to speak. Honorable Nita.
Thanks, Chair. Let me appreciate the presentation by the MEC. My question, Chair, is on the issue of the infrastructure budget in schools. When we're doing visit, Chair, we were told by principals that their infrastructure budget, they are instructed by the department that they should be using it for COVID-19 related issues within the school, which include, Chair, issues of buying some of the things that the department couldn't buy. For instance, protectors for non-educators, protective clothing for non-educators, Chair. So I would like to know, because those schools, Chair, they still have their own challenges of infrastructure. apart from what they are instructed to do? Is the department going to again give those schools back their funding for the infrastructure? That's one that I would like to know. The second one, Chair, is on the issue of educators who are already having underlying diseases, Chair, that they have already applied to their principals that they are unable to come back to school. So now the challenge, Chair, is that some of those teachers, they are teaching critical subjects within their schools. Now, what I would like to know from the MECs, from the minister, is that, is there a system that could be set up that will allow those educators to be able to educate whilst they are at home? A sort of hybrid kind of a system. Some educators at school, some educators do education at home to mitigate against the possible challenge of students not having teachers like that they are doing math, some they were doing physics. I pick up that in Port Elizabeth, Chair, and I thought I must raise it so that before we get more of such cases, we are able to mitigate. So I would like to know from the department if that is possible to have a hybrid system to mitigate on the issue. Thanks, Chair.
Thank you, Honorable Rita. Honorable Kluter.
Thank you, Chairperson. Thank you, Minister, for your time and giving us this information. My question is actually short, and if the question was raised earlier, I'm sorry for that because I was in and out of the meeting. It was mentioned earlier I think it's 1,557 schools that have been vandalized. I just want to know whether the department has done an audit to find out what the cost will be, because we do look at the 5 billion rand catch-up plan. I'm concerned that much of that 5 billion rand catch-up plan is going to be used for the upgrades or the maintenance of these vandalized schools. So do we have an amount, a global amount of all the schools that has been vandalized? How much is it? And how will it affect the catch-up plan? And then also adding to that, when we look at post-COVID-19, if we could look at something like that, when will these schools be able these vandalized schools be able to function normally with infrastructure that has been maintained there? That's just my two questions. Thank you.
Thank you, Honorable Kluter. Honorable Lutuli.
Thank you, Chairperson. I was expecting the minister to tell us of the schools that are still not open due to so many reasons, more especially in KZN. And also, my other question to the minister is that there are schools in KZN that have a shortage of classrooms, schools that are struggling as we only have a grade 7. So as we are approaching the next phase, they be struggling a lot since they don't have classrooms. I will mention one school in the north of KZN in Tonga, a school called Makuyane, which they were promised mobile classrooms. Till today, those classrooms haven't been delivered to schools. And also, Chairperson, my house and the main road is like 2 kilometers away. So sometimes in the morning I wake up and I just stand on the road and look at the kids going to school. You find that this social distancing, the kids don't understand. And the issue of masks, the kids are not wearing masks in the taxis, even if they are walking on the road to school. So by the time they get to school, the damage is already done. So I think the department needs to reconsider, and they need to look deep on how to save our kids, because most of kids are going to be infected. Yesterday, we learned that one of the schools in Bredwe, Amashia Market, is closed because one educator was tested positive.
is the first school in Dwedwe that is being closed. And it shows now that this COVID has attacked even the rural areas. So what is the department doing about it? Thank you so much.
Thank you, Honorable Julie. Honorable Gillian.
Chairperson, thank you very much. Let me welcome the presentation by the Minister. Chairperson, 2 issues. The first one is on comorbidities and the ruling by the department. Chairperson, a lot of our teachers is unsure about this kind of comorbidities and the way that it is been handled by the department. A lot of the teachers, Chairperson, did apply through the relevant channels, but did not get any answers yet. I want to know from the department, when are they going to give clarity to the teachers on this? Under comorbidities, Chairperson, 52% of all deaths registered is because it's people with diabetes. 19% is high blood pressure. 12% is HIV/AIDS. 9% is people living with high blood pressure. 2% is people who currently suffered from TB, and 4% is people who previously suffered from TB. Now, the reason why I'm giving this stats, Chair, is also to ask the department, how are they going to look into this applications of teachers suffering with comorbidities? Then secondly, Chair, in doing our oversight as members of Parliament, it is really heartbreaking to get 10 to 20 inquiries per day from parents regarding when there is a positive case at a school. That school don't close down. The tracing of this virus is not done properly. When you ask questions to the relevant school principals, especially here in this province, the answer that you get when you ask why was the school open when there is a case, a positive case identified at that school, the answer is we're waiting for the department to come back to us. In my constituency, Chair, which is a high, it's a high risk. It's a hotspot in the Theewater School in Western Cape, the Grabouw area. 7 schools has been closed and open and closed and open. But what is serious is when you receive the calls from parents to do follow-ups, you will see that a school has not closed when there was a positive case. When you then do further inquiries, the answer that you will get from the principals is that we are waiting on the department to come back to us with a way forward. Now, my understanding is, no matter where it is, if it's a school, if it's a factory, wherever it is, whenever there's a positive case, it needs to be closed down. It needs to be sanitized. There needs to be a tracing. People needs to go in isolation or in quarantine. Why is the schools not treated like any other business in this country? Chairperson, I want that clarification, and I want the minister to give us and the community out there in this province the assurance that the right procedures are followed. And if the right procedures are not followed, where must these parents go to? Thank you, Chair.
Gillian, thank you. So, we are going to give the last two people will be Honorable Baha and the Chief Whip, because the Chief Whip is also indicating. And after that, there will be responses. So I don't think we will have time for a second round. Honorable Baha.
Thank you, Chairperson. Let's welcome the report by the Minister. However, Chairperson, I had 1 or 3 issues that I want to talk to. The first one, Chairperson, is in instances where some schools have not opened, learners have been accommodated in neighboring schools that have capacity. But what I want to check is what impact has that had on those schools that are accommodating others? But further than that, Chairperson, on the same issue, we are approaching the second intake of learners. And now, how is it going to be addressed in terms of those schools that cannot open at all? The second one, Chairperson, is around the issue of curriculum. There's an outcry that the curriculum has not been adequately revised or reviewed to an extent that it might be difficult for schools that have not yet opened to be able to catch up in an endeavor to kind of recover the lost academic time. Now, how is this going to be mitigated for schools that have not opened at all? Especially if you look at the grade 7s and 12s, who would have to write a paper that is already set already. The third one, Chairperson, which is the last one, is around boarding school. What is the state of readiness in terms of boarding schools accepting learners? I'm asking this question, Chairperson, in mind with the recent case of Makaula Secondary School in Mount Frey in the former Transkei, where around 180 learners tested positive to COVID-19. How is the department handling such an issue? And how do we make sure that such issues are minimized to the lowest in terms of impacting the return of learners to our schools? Thank you, Chairperson.
Thank you, Honorable Baha. Honorable Chief Whip, you will be the last one, and then we will give over to the department.
Thanks very much, Chairperson, and I join hands with my colleagues that appreciate the report of the Minister, which touches quite comprehensively on a number of issues. Minister, for me, it's just a comment which we may respond to, is that having engaged with this work so far, do you think that the area of public awareness and to the volunteer program dealing with the pandemic has been adequate, or what is it required in your view? Because this requires a multifaceted approach that all of us, everyone has got to do their part to prepare our response to this pandemic. I do feel that if we are to succeed to make school centers of community life, mobilization of various sectors of the community is required in a sustainment. Thank you
very much. Honorable Minister, I deliberately made sure that we take as much questions as possible so that you give a comprehensive response and we don't get the responses piecemeal. While responding, also touch on the issue of school nutrition, and I know you touch on the issue of scholar transport. There was something about scholar transport, but touch on the issue of school nutrition so that we also can know what is the way forward with regards thereto. And we are giving you 30 minutes or more so you can respond to, and also you can ask from your team to assist when necessary. Thank you. Minister, over to you.
Thank you very much, Chair. I hope you will also allow the Deputy Minister to come in case I have left other questions whilst taking notes.
We will definitely allow them.
Okay, so, okay. No, thank you, Chair. Chair, there was a question from a colleague about KZN and challenges that are there. And she's quite correct, Chair, that in terms of water delivery, we've been meeting quite a number of challenges. And the challenge she raised is true, understandably so. And it's not only in KZN, it's happening in the Eastern Cape, it's happening in Limpopo, where water tanks, when our water tanks are on their way to school, they have to pass through a number of villages which don't have water. And villagers have been stopping, disrupting those water tanks. And it's understandable because they see water passing them, going elsewhere once they need water. I have raised the matter with the president that we are experiencing a problem. I've been speaking to my colleague from Water and Sanitation, but the problem is even bigger than myself and the minister because it's a local government problem where we have communities without water, and in return, those communities are helping themselves to the water to schools. In some instances, Chair, we have reports that were told that we're sharing the water with communities. So where we have water tanks, we have filled them up today. The next day they're dry because in the afternoon, when people need water to go and do their washing, they go and draw water in schools. Again, it's understandable that those people need water. And that's why this matter, it's being discussed at that level to say, as the sector, because it's not our core competency, we're finding it difficult to cope, but we, as I say, it's understandable that people would be helping themselves to water, but the answer is that we are attending to it and we're aware of that problem. On the catch-up plan, Chair, I also didn't want to take much of your time around what constitutes the catch-up plan, because I think the member is right, is that if we don't deal with the loss of time for 2020, we may have longer-term problems in terms of curriculum deficits that our kids are going to go up with. For instance, we're saying after the seventh intake, we will not have enough space for the group that is going to come in August. And in return, we are looking at platooning, at rotational, so which means we'll even have reduced long-term for the learners. And that's why we then, in terms of catch-up plan, we have catch-up plan to assist them to just cover the little curriculum that we're giving to them this year. The grade 12s, the catch-up plan that I received from provinces, it's very intensive. It's camps, it's Saturday classes. Most schools are starting already in the morning at 7:30, leave at 4. They have Saturday classes, they have Sunday classes. So that's part of the plans that we have, and even the camping. But the long-term problem, we are aware that it will even hit us 3 years down the line. You're going to have kids who were supposed to have 12 years of schooling coming out of the schooling system with 11 years of schooling. So the catch-up plan is also looking at the risks and what are the deficits that we're likely to suffer because of the virus. So it's multi, as I said, it's got short-term, it's got long-term. Amongst other things we're looking at, so I'm answering the question about the ICTs, which comes later. Amongst things that we're looking at, it's really having learned from the environment or the COVID-19 environment we find ourselves in. Clearly, ICTs can help us leapfrog some of the problems that we're encountering. As a sector, we were halfway, we were digitizing, digitizing our workbooks, having interactive programs in order to build towards an ICT program for education. But it's quite clear that we have to really hasten our pace if we're supposed to be able, if we will be able to deal with the problems that are going to come out from this crisis that we're in. So part of the catch-up plan is to help us to deal with the immediate, the next 6 months, but also to say, how does this virus change the education landscape? And we are saying ICTs are going to be one of the key factor that we have to factor into a change a plan, and we're looking at it. The other one about quality of tanks that have collapsed, I don't have report, I don't want to deny it. What we have said, because we have our QLTC team working with provincial QLTC teams, to say because we're rushing to do things, it's likely that there could have been some conquered work elsewhere, and we really want them to give us information so that we can go back to our service providers to read, because we've paid for those services. So there's no reason for us to take any mediocrity in terms of the services that we're receiving. So we'll be very grateful to be informed. I had also been sent images, and we have dealt with those. But again, that's where we really want our committees to assist us in dealing with our service providers. In terms of the capacity of Rand Water, what Rand Water did, which I thought was brilliant, they've partnered with all the water agencies. In Limpopo, they work with Lipelle, but so they are just working with us in terms of coordinating at a national level. In KZN, they will work with Umhlatusi. So they work with the provincial water agencies to beef up their capacity. And that's why I say when we really felt that they were not coping themselves, we even had to get DBSA to come to the party. And more importantly, we even had to get South African Defence Force also to join in with their engineering capacity to help us in areas where we still felt we're not doing well. I received a report yesterday about the progress that we are having, and the only area I was told that we are still continuing to experience problems was KZN, that they were not adequate. We will be able to get them before the next cohort. There were also some challenges in Limpopo. As I say, challenges in Limpopo start off again from this problem about tanking of water, where water just does not reach schools because it's interrupted on the way. And as I said, we're dealing with it. There was a point around ICTs, which I fully agree with. I think we will have to continue working with my colleague from communication, because you're quite correct. We have been working over the past 4 years on ICTs in education. We have digitized our information. 80% of our information is digitized. We have trained teachers. So in a way, we are almost there to be able to have virtual classes where we can give children tablets. And any other strategy may not be aligned to our strategy and may not enhance the work that we're doing, but it's a matter that we need to continue to engage on with my colleague, who is in communication and has had this tender on TV. So it's a matter that I think we'll deal with, but I agree with your strategy. That's the correct way. And that's how our plans have been going on. And that's how we are proceeding on ICTs in education. On screeners, every province used different methods. In Limpopo, they were able, in Gauteng, for instance, they used the brigades. In Limpopo, they used another method. They've engaged young people through CETA, who do the screening in the morning, and after schools have started, because after that, after the traffic has started, then those young people are used as admin clerks and to do other work in the school. Northwest has a different process. Western Cape, for instance, they had really started off by using teachers whose grades have not come in, and every province has used a strategy, and we've agreed we've agreed with provinces to make sure that the principle of having a screener, whether they get them as brigades or as administrators, as volunteers, as health workers, in some areas they're using your health, in some areas they're using your public works program, all have been trained as screeners. So different provinces have used different methods, and they have used young and old. As I say, in Limpopo, it's young administrators. In Northwest, it's young administrators. In Western Cape, they've used teachers whose grades have not been phased in. So it's different methods, and we didn't have any problems with it. In terms of engaging young people, I've been hearing that a lot, even in terms of communities to say, I've not consulted. We're a big sector with 14 million learners, 400,000 teachers, with SGPs that we elect on an ongoing basis. And we just do think our capacity to communicate outside schools is very limited. We communicate with communities through those organized formations, through your SGBs, through your teacher organizations, through all the NGOs that we work with. Otherwise, we just don't randomly are able to convene meetings and say, please come forward. I communicate with COSAS quite regularly because they are one of the few organized students' formations. And members will know that they are all dynamics. There are parallel structures. So if you're speaking to this one, the other one is owns, but we were talking to them all the same. It's not our business how they organize themselves, but they help us to really hear the voice of young people. There was also an issue about how we help learners who have not come to schools. As I said, different provinces and different schools have been allowed to develop measures which enable them to operate. For instance, if you are in an environment which is not ICT advanced, there is no way you can beam classes to children who are at home, because it means there must be a level of connectivity which may not be available in other areas. So for instance, what Gauteng has done is to say, parents you first have to declare, just can't stay at home because we're not sure, maybe you're not staying, maybe you're in another school. Say, I'm so-and-so, my kid is not coming. Here's a doctor's letter, there's comorbidity, the child cannot attend, from the doctor. Then the school arranges, so you can have an overall plan that you can come every weekend to pick up your child's work and bring it back on Monday. In some schools, like your model C schools, where they're able to communicate through ICTs, they're able to communicate through your phones, they're able to communicate through your laptops, any other method, smartphones, any other method available. So to make sure that we don't have one size fits all, we have agreed that schools and provinces on principle will have to devise measures to support learners who cannot come to school without saying how, because different areas will be very different and different communities will have different abilities to respond. The main thing that we are running away is running a school under COVID-19 is not easy. So we don't want to run a parallel system. So if you've decided that I'm anxious, my child can't come to school, for the first time we're saying we will not deregister your child until such time that you bring your child. According to SASSA, if a child is not at school for 10 days, that child is automatically deregistered. But we're saying because of the challenges that we're facing, we will allow learners to stay longer and come back when they are ready to come, but it will be the responsibility of parents to make sure that they catch up, because the teacher can't just block the whole class and really help two children to catch up. So different schools have been allowed to. The question of teacher comorbidities, there was a specific question, how many and other things. Chair, we can gladly give you the figures. We received the figures on Monday, province by province. For instance, because I had not intended to speak about the statistics of comorbidities province by province, but we have the figures that we got from provinces in terms of how many teachers have applied, how many teachers have been permitted, which takes me to the other question, because what we got on Monday from a report with CM, that I think communication is a problem. There are clear protocols on how to deal with comorbidities. If you're a teacher, as I said earlier, you have high blood, you are hypertensive, for instance, you are 60 or less. It's not your call to say, I have a comorbidity, I have applied, therefore I'm not going to school. You have to bring, not even a doctor's letter which says you have high blood or you're diabetic. It's not what we accept. Your doctor has to assess you and say to us, the doctor, not anybody else, not even the teacher himself, and say this person's high blood or sugar diabetes is uncontrollable or is uncontrolled. Therefore, they qualify for comorbidities. But you don't determine yourself, which is what most teachers have done. They just declare that I have high blood, I had cancer, I'm 58, I have comorbidities, I'm not coming. So we're trying to mop up that area because they're risking, it's a huge risk on their part because it means they're staying home without permission. So you can't decide, until such time you're given permission, you can't decide to stay home. We are also picking up that and doctors have come back to us to say your teachers, ministers are coming to us, putting us under pressure to say they can't come to work. We're also investigating other letters where indeed doctors have given people letters and there's doubt as to whether indeed this person's high blood or sugar diabetes is uncontrollable that they can't come to work, because it will really affect us negatively. There was also a question about, so we can't deal with it overall. The question of comorbidities, as national, we have put norms and standards. Provinces have to implement it, and they have to implement it normally. And if there are difficulties, they can come to us case by case, province by province, but we're not dealing with it as the province. It has really revealed to be one of the most complicated exercises that we're faced with. On school fees and exemptions, again, our advice has been that let's deal with this matter school by school, and learner by learner, and parent by parent. In private schools, the same principle we use where we owe cars. We don't say government, there was COVID, people are going to lose jobs, we can't pay. No, it's a debt you have signed in a private school. So if you can't sign, go to the principal, go to the school. We can't have an overall policy because those schools, especially private schools, are not funded by the state. There are no budgets for them. They rely on the agreement that they have with parents. So if as a parent you can't meet your obligation, it's a matter between you and the school, school by school. In terms of school governing posts, from where I sit, Chair, I don't see us being able to get rid of them because with this social distance and this physical distancing, we find ourselves using more teachers because, for instance, in most schools I've gone to, when they had 5 grade 12 classes, they've ended up with 11 grade 12 classes. So which means the need for teachers has doubled. The problem that had arisen, which we had requested provinces to really do with public schools, is to assist your public schools, not private schools, where parents, especially during the lockdown, were not paid, and therefore the salaries of your school governing posts were being affected. So again, it's going to be school by school. It can't be overall. We can't generalize and say in all your Model C schools, parents are unable to pay, therefore they should not pay, the province will give money. The only thing we said to provinces must do during lockdown was to pay the tranches that are committed in advance, because there's no fresh money. So we can't commit money which is not there. But I doubt if your Model C schools will be able to get rid of teachers. We need them, to be honest. We are already looking at even complementing teachers, especially because of this physical distancing. It has presented a huge burden on us. And that's why we're looking quite tightly on this issue of comorbidities, so that people who don't qualify to stay home must not stay home, because it's going to stretch the system beyond its capacity to operate. But we're also looking at really recruiting more people to come and assist us. Again, there was this question about looking at Western Cape, and we're saying Western Cape is not the only one. Gauteng and Eastern Cape are huge threats. There's really serious concerns that we have about those provinces around paying attention to the lockdown, which we are. The Makaula issue is a case in hand to show that indeed, because what is clear, parents, teachers, and learners represent what exists in communities. In areas where the infection rates are low in Limpopo, in Mpumalanga, we rarely come across an infected teacher and an infected learner. In Gauteng, Eastern Cape, and the Western Cape, because the incidents are high, they reflect themselves in schools. That's why we're going to have to close down, close, open. And one member says you can't run systems like that where you close, open. And I'm not sure, I'm sure even business, we all have to go back to lockdown 5. Because even in shops where we go, I went to Woolworths last time, I found it that they had closed because they had discovered that they were fumigating, that some of their staff members had been infected. So it means Woolworths must close all its stores. That's not how we're going to operate. We're going to deal with issues case by case. The National Advisory Committee had said repeatedly that ourselves as citizens, we have to be ready to live side by side with the virus. So we're going to close, open, close, because that's what is it's demanded of us in dealing with this virus. So we are definitely looking at having a differentiated approach to those provinces. It's Gauteng, Eastern Cape, and the Western Cape. I mean, Gauteng has already jumped the 20,000 margin. So it is also beginning to give signals of a problem, of a province in trouble. There was also a question about whether parents can sue, whether people, schools have been asked to write indemnity. And I think in that interview, the coordinator of the schools, of the private schools, explained to say whether you can make people sign indemnity forms. If you have been negligent, you are not indemnified. So the whole exercise, an exercise in futility, because if you have been negligent, you can't be indemnified. So you will pay for the consequences. And I think what we have been doing is to discourage private schools, bearing in mind that it is private schools. In laying norms and standards for schools, there are limitations as to how we tell them how to run their business, having agreed with parents that they want this private relationship with them. So it's a private relationship. We just come broadly in terms of really norms and standards, but we don't run them. So there was a question whether we are going to, how do we go, how do we close, open, close? I don't expect us to go to normality in the next 2 years. So we might as well as say for the next 3 years, we suspend education because that's what is going to be our lives. So the main thing is, what is it that we do, as a member from KZN said, what is it that we do ourselves as activists and as public representatives to educate our people? Because as the Minister of Health says, we have reached a state where there's a limitation, there's a limit to what government can do. So what can be done is that which we can do ourselves and the communities and government. But we can't really have a situation where we think we can run away from coexisting with this virus. So we are going to close, open, and life has to go on as normal under very difficult conditions. Chair, there were statistical questions asked to me, so I really will beg that let them be written, because in my head, I don't keep how many people have been infected with school. I can give it, I mean, I didn't bring the Monday report, so which means I have to go through my notes and say in Western Cape, 500 was reported on Monday. It's a statistical question. And the practice is that statistical questions have to be sent in writing. So I'm humbly requesting that where there are statistical questions about how affected who, when, children, let me be asked the question. I will honestly submit the answer as soon as possible, but I won't have statistical answers now when I don't have the files or the notes which are national. The alternative in terms of plans, again, Chair, is to say schools are run by principals and provinces, and they've always done it very well. They are the people who understand the terrain. When we said children must go back to the schools, they obviously have a plan. I assume that they have a plan. Some schools already have had their children taken back. some schools, for instance, I'm glad I see MEC from Western Cape. Some schools were even going to close permanently, put mobile. So there's a plan on how to deal up to the July issue. Again, we can give you details of plans of saying what is our plan in terms of alternative plans for schools that have not opened. What provinces had to do, and which they have done, is that no child is left behind. If the school was not ready on the 8th, they have the whole month to get that school ready. And provinces have been working on it and taking children back to their original schools. And where there are a few cases where we are not able to use this month of June to remedy a problem, they have a plan in terms of mobiles on how they're going to accommodate those learners. On questions of transport, Chair, we rely on transport regulations because we can't regulate, monitor anything outside our control. It's only transport provided by the state where we have transport monitors. But in parents' cars, in taxis, we rely on the guidelines that come from the Department of Transport because it's out of our control. I've spoken to COSA's issue that we talked to them, but even the other question to say, why don't we close? And then I think the horse has bolted. I mean, it's a mute question. If you agree with me. We have opened on the 8th and we're going on. We're opening on the 3rd, we're going on. We're opening in August, we're going on. We've given the motivation and reasons why we think it's important to continue. But to say, why don't we wait? Maybe we opened too early. I think the horse has bolted, comrade. It becomes a mute question because it doesn't help. There's no way we're going to close schools now to say, hey, there's been a question from Parliament, why did we open? We have opened and we have given the case. And what is consoling us, Chair, is that parents have responded. I'm saying 98%. So which means the very people who are directly affected are supporting the move. They will not have sent, 98% of parents will not have sent their children to school if they were in doubt of the rationality of closing schools. 98 parents of children will not have come to school if they were in doubt about the rationality. So the response confirms the correctness of our decision. So indeed, there is this 4% or 2% that may still be in doubt, and we understand that, but let's go on with the majority that have responded, and by their response, confirm that they agree with our decision, because we can't go back. On the infrastructure that is being used for COVID-19, that's what we've all done, not only schools. Nationally, I had to, because there's no new money, I had to use all the money for music competitions, for teachers' awards, every other money that I had to respond to coronavirus. I've had to spend 200 million with Rand Water to supply water for provinces, which is not even our competency. And that's money that we took from our infrastructure money, which was not meant for water in provinces. And it's because the COVID-19 response has become urgent. So we've said everybody, now that there's no athletics, now that there's no singing, now that there's all the other things that we do, the only thing we're facing here is to be COVID-19 compliant. Use your money to be COVID-19 compliant. If it's infrastructure that you have to spend your money on, spend it. If it's fencing that you have to spend it, because that's what is now critical. And indeed, we're not going to refund, no one's going to refund, we're going to refund. There's no new money. That's the point I'm trying to make. And that's why we're using everything that we can. So vandalized schools, again, I can give, because there was a question, how many were? I can give you numbers. I know that we're around the number of 2,000 schools that we have been vandalized. I know there's a breakdown according to provinces. The last time I spoke to provinces, there were more than 100 arrests that had been made, but it can be updated. As I say, as late as yesterday, Free State showed reported a school that had been vandalized. So it's a moving target. Again, Chair, we will respond in writing, give you details and the proper figures, because I don't want to say it's 500 arrests, and then tomorrow you come and say I misled Parliament, it's actually 100 arrests. So I'll give you the right figures. Class shortages, we're dealing with it again, because the other men say how many, what. We have done the reconciliation. We can give you a full report.
Minister must remember that the MECs will also speak with regards to specific issues. I mean, the MECs will also have a round where they will update a little bit. So just to make it easier for yourself, yes. Okay.
Yeah. On curriculum, the curriculum check was done by a team of, so when they say there's an outcry that the curriculum was not properly done, it will be helpful to get what the responses, what the issues are when which members have to raise. Whereas the trim of the curriculum was done by a joint team of national curriculum experts, provincial experts, and also your academics outside the universities to say, these are building blocks which have to be accommodated. And even the trimming was informed by the reopening to say, if this grade opens in August, they can only deal with the following has to go to next year. So it was very well curated, but I'm not saying it's perfect. I think members might still have more ideas. The Makaula Secondary, I'm glad MEC is there, because it also confirms our point of saying schools help in terms of screening. Because those learners and those teachers were identified during the screening process. So which means they were infected in their communities, and then they were picked up when they went to school. If they had not come, they were going to, and the MC will explain what measures were taken to make sure that as they arrive with infections, they don't spread the virus or they don't infect others in schools. But that's for me the case why it's important that schools have to open. And as I said, Eastern Cape, Gauteng, and Western Cape are a special factor in terms of the outbreaks, because it's quite clear that there are outbreaks in those provinces. And I like the Chief Whip's question, the last time in a question about, I'll get to the communication. What is going to save all of us? It's communication. One member said, and she's quite correct to say, she stays next to the school, the kids on their way to school, there's no social distancing, they don't wear masks. The schools I went to, when I was asking teachers, what is the compliance? Teachers were saying, take off them. And they've already gone out of the control of teachers. So during the day, in the schoolyard, they wear masks religiously all the time. As soon as they leave the gate, they remove them. They start hugging each other. They start doing all sorts of things. So which means as a community, the communication is going to be extremely important as to how we overcome this. And on school nutrition, Chair, I did indicate what steps we have taken to make sure that we also have safety measures in nutrition. Those that have come to school, we have been feeding, and we have also started feeding those that are not at school. But because some of the learners in schools who are not at school are being transported, we are not giving a child a lift from Pimville to go and be fed else in another township. What we've agreed with schools, because they're all public schools, they must feed children in the neighborhood, so that even if it's a child who doesn't go to that school, if it's a school child, they present themselves, they should be fed. And that's what we're doing on the school nutrition part. Yeah, so some of the things, Chair, we're not able to account for them because it's only 14 days since we've opened schools. Some of the questions are things that we're monitoring, and we're not able to give you a comprehensive answer to say, yes, this has happened. We are still monitoring. We will be able to give on an ongoing basis what has happened and be able to account for some of the things that happened during the 14 days. That's why I'll be surprised when teachers said the curriculum has not been properly trimmed. There's only one grade, it's grade 7, so which means the grade 7 curriculum has not been trimmed because other grades have not come in. Grade 12 curriculum is not going to be trimmed because they're going to write a full exam. So Chair, there are lots of questions, but I'm saying we will gladly answer specific questions if we get written questions, and then we'll send them to you immediately, Chair. Thank you very much, Chair, for the opportunity. I'm not sure if, yeah.
Yes, Minister, with your indulgence, we will just hear from Dr. Maule, your deputy, whether she's got anything that you want to add with regards to the responses. Honorable Dr. Regina Mahole.
Thank you. Thank you, Chairperson. I think Minister has tried to answer all the questions because I've been writing them down. Mostly members were concerned. The questions were comorbidities of teachers, water and sanitation, communication with learners, which Minister explained. We also believe that schools do communicate with their constituencies, which is learners. So we cannot expect the minister to move and communicate with all the 13 million learners in South Africa, but schools in particular, because the learners are their constituencies. Then another concern was the SGB appointed teachers, which minister, of course, answered correctly that it must be dealt with school by school. They did. We discussed this matter with the Association of School Governing Bodies and the school SAPA, South African Principals Association. We did discuss these matters that let teachers not be disadvantaged because of COVID-19, but what is applicable to all the employees of South Africa, including ourselves, must be applicable. They still have to pay, those parents have to pay school fees, but at the same time can make arrangements with school, like we are all making arrangements. So Chair, some of the questions, I'm just mentioning the key questions here, that some schools are opened, what will be the implication wherein other learners were taken to another school, that what will happen then when the second cohort is coming in. So planning, Minister indicated planning is continuous. So we are looking that, okay, now you have accommodation to accommodate the learners from the school, but it doesn't mean that we're folding our arms on the school where the learners are from. Those learners are still, the schools are still taken care of by the SGPs, the department, the provinces, and the districts. The issues about boarding schools, we cannot just say boarding school is a boarding school, so all learners must just go. We count, we adhere to COVID-19. Then and also improvise where we need to. But for now, it's only grade 7 and grade 12. And even the next cohort is not all the entire school population that will be coming. It's a certain grades. So principals and SGPs and seconds are busy planning for the second coming, and they know exactly as to how many classes do we need, how many chairs do we need, and they know that when the second phase comes in, then the learners will fit in the existing infrastructure. But we may have a problem when the entire school population comes in. That's when the preparation is looking at. The issue of infrastructure budget, Minister answered that. The issue of Western Cape, which really it sounds it's a concern, but Minister also indicated that it's not only Western Cape, but we have Gauteng, etc. Then on the scholar transport and private transport, all these are regulated by the Department of Transport. So they know the rules, they know what to do. We are working with them as our stakeholder, but at the same time, they adhere to the rules of the Department of Transport. Same as National School Nutrition Program, which Minister indicated, which we are still planning as it schools are planning to feed even those that are not coming to school. So my request, like Minister is requesting, specifics. We request that let specifics and statistics come in maybe as a written reply, because now the Minister is coming to give the readiness and the feedback for the past 14 days. But when we say how many percentage, how many schools, how many learners, I'm not saying it's not fair, but she might not have that information, like I don't have that information. So we'll request members that when coming to specific and statistical questions, let's put them as oral reply, or we send a question indicating that we'll want to know the percentage of learners that are infected. Then we'll be able to check with provinces. But generally, Chair, I think Minister has covered all the questions which have been asked, except for the specifics. Thank you so much, Chair.
Thank you very much, Minister and Deputy Minister. Also, thank you to the members for the questions. With that, I will now give over to the House Chairperson, Honorable Jomo Nyambi, to preside over the rest of the program. Over to you, House Chair.
Thank you, Deputy Chairperson. Greetings to the Chair of the NCOP, to Minister, Deputy Minister, colleagues, and all the special delegates present today. As we get to the next item, we know that we are the House that represent the interest of the provinces. Without much ado, we'll allow our special delegates represented by MECs and chairs on provincial specific progress made on measures to manage the impact and spread of the COVID-19 pandemic in our respective provinces. I'll be doing them in an alphabetical order. Strictly 7 minutes maximum. If you do less than that, it's fine, but we can't go more than 7 per province. We're starting with Free State. It's MEC of Basic Education, Honorable Kade. Eastern Cape, Honorable Kade, I'm sorry. It's Eastern Cape. Honorable Kade, Eastern Cape.
Thanks, Chairperson of the House, and good afternoon, Minister and Deputy Minister, colleagues from provinces, and also delegates of the NCOP and the participants in the meeting. Chair, we have assigned all institutions of learning in the province into the Department of Health institutions across all districts that we have, the 12 districts we have in the province. That's the aligned program of government, so that we can have a very significant proper tracing and proper screening and testing of the kids and whoever is part of that program within the institution of education in the province. But I think it's going to be important, Chair, maybe to reflect on what kind of an animal are we dealing with in the context of COVID, the impact and the infections in the province, so that we are able to locate the sector properly, so that the strategy and tactics, interventions thereof can speak to the reality and then be aligned across all sectors that are part of the integrated planning in dealing with the COVID-19 in the country. One, Chair, in the province, we have tested 18,180 people. Out of that 18,180 people, the Department of Education can claim or account for 1,804 cases. What does this mean, Chair? It then means out of that 18,000, for example, from the cohort of learners in basic education, from the age of 10 to 19, we have got 196 cases of kids. We don't have a registered case of 0 to 10, but we've got a registered case of 10 to 19. And that's how far we have gone in relation to that cohort of age. But again, Chair, from that 1,804 cases, we are speaking of 1,257 kids that have been confirmed as tested and positive in the province. Now, if therefore 1,257 are the tested and confirmed cases out of 18,000 people that have been tested from the 1st of June to yesterday, as the report from the Department of Health indicates, it then reinforces the debate that is raised by the minister, that there must be a closer look whether this virus is not making more people vulnerable in the villages and also people that are not controllable on the streets. And therefore, as the sectors are reopening, there come the emergencies of outbreak from the sectors that they are directed to, as the president is giving a directive to say, now we are at level 4, now we are at level 3, now we are going to level 2. And I think that discussion at the level of parliament is going to be needed to be engaged. Again, Chair, as I closed on the matter of statistics, we don't have a registered death of a kid in the province. Again, I'm saying, what does that mean? What does that mean? Now, let me come back to what has been raised in the context of other plans that are in place. Yes, the minister is correct. We have dealt with the issue of the comorbidities, and they have registered all of them, and the sector is busy working on ensuring that we resolve the matter. But equally, it is going to be important that we also raise sharply that it is proper that we understand each other, that this is an application, not a confirmation. And once you have got an application that has not been confirmed, but people have already absented themselves in the institutions of learning or from a working environment, it then creates instability. Creating stability in terms of execution of the work. It also creates instability in terms of the performance of the system itself, so that we can render the services as expected in that particular regard. We are therefore again have taken a decision that tomorrow I am going to Makaula Senior Secondary School in Manfred, just to put people at ease on the plans of the provincial government, and also on the interventions that are put in place, so that we can benchmark on this virus in that corner of the province, in Alfred Nzo, using Makaula as a benchmarking area. I'm raising that, Honorable Chair and the Minister, primarily because out of the 283 learners that have been tested in that institution, yesterday it has been confirmed now that it is 204 by health that have been tested positive. But what then becomes critical and a question that tomorrow we'll have to answer, because Makaula is one of the schools, medium schools in the province, with a velocity of resources and a boarding hostel. It's not as vulnerable as other day scholars that are in villages. So hence it is important that we also be able to trace the infection from its own origin. By the way, Chair, if I can have just a minute of your time, the outbreak in Makaula is as a result of our own systems of government that are working. We identified that in Makaula, there are kids that are infected that originally were 24 when the schools were reopening. Within a space of a week, we then said, no, let all of them be tested, screened and tested again back, so that we can be sure what exactly is happening here. Now, last week on Thursday, those results came back and confirmed the statistics that I'm giving you now of 204 learners that have been tested positive. Now, meaning that we run a risk of people that are going to die silently if we have not opened schools in the country. Because I have not seen a person that, except the ones that have got symptoms. Now, the schooling system in the country is, by the way, assisting us getting into the deeper meaning of what this COVID is in essence, and be able to position government properly. Hence, my argument is that having not tested those kids, there would be no outbreak and there would be no news in the media space. But I can guarantee there will be deaths. So it's proper that we be able to locate this Makaula issue. Yes, I agree. There are issues relating to facilities for boarding, for quarantine and isolation, in particular in the Alfred Zoriti, which I was talking to the Department of Health yesterday, Department of Public Works, but we'll be sorting them out, Chair, tomorrow morning, because we have summoned all those departments that have got direct impact on the strategy of the province. Your Department of Health, your Department of Education, your Department of Public Works, your Department of Social Development, to meet with the district directors of that area at Makaula tomorrow at 11 o'clock, so that we find a way of consolidating and be able to snip it on the bud and close the matter of Makaula and be able to develop a plan that talks to the entire Alfred Zoriti, so that we don't be swayed by Makaula and lower our guards in other institutions that have got camps for grade 12. Because remember,
as you conclude, MEC, can you round off?
Yes, I'm saying, remember, we have got a duty of ensuring that grade 12 pass this year. So there are camps in the province for grade 12 across all districts. So that's why I was then saying it will be imperative that we have got a plan that does not talk to Makaula, but rather talk to the entire district of Alfred Zo West and Alfred Zo East. Honorable Chair.
Thank you, MEC Kade. I was informed that Free State is still struggling. Is Free State in now? It means it's not yet in. We'll get the chairperson of the portfolio committee from Gauteng Province, Honorable Chilwane. Honorable Chilwane.
Thank you. I hope I'm audible.
We are audible, Chair.
Thank you so much. Let me first start by greeting yourself, Chair, and the Minister and Deputy Minister, and all the leaders of different provinces, special delegates, honorable members. Thanks for the opportunity. I thought I should start by maybe giving a brief update that we've just passed our budget processes, and our budget has gotten an above inflation 7.6% increase, which is quite notable, that I should share, which is quite, it took us to 53.3 billion. That's our allocation thus far for the current financial year. And notably, what we've also is an issue that of concern that we have raised and was around infrastructure allocation, which has seemingly dropped, considering the infrastructure challenges that are faced by schools in Gauteng province. But that is got to do with the institutional arrangement in the main, where we have a client department, in our case DID, that is responsible for our capital projects, which really in the main has really struggled to deliver, and that has affected our allocation over time. But that, with that said, let me get back to the order of the day, which is the response to COVID-19. Honorable Ngoenya raised some key questions, and I thought the minister would respond, but I knew that if you didn't have beforehand the recent figures, you might not be able to. Just to bring Honorable Ngoenya up to date on the figures within Gauteng with regard to infections and schools that are affected. As things stand, from the 23rd of June, we have got 176 schools that have been affected. And that is out of 2,161 schools that managed to open on the 8th of June. That is about 8%. And with regard to learners, we currently set at 58 learners that have been confirmed to be affected by the COVID. And with regard to teachers, educators in the and staff is 188 thus far, as of the 23rd of June. So anything could have happened between the 23rd and today. So, but that is the latest figures that I thought I should share with Honorable Ngwenya and yourselves. And the other update that I should share is around the comorbidities. This word is very difficult to really wrap the tongue around. With regard to our province, we've got just under 1,000 applications, and I must say the department is more than ready to respond because there are substitute teachers ready and also support staff. So the application thus far is just under 1,000 applications within the province. So with regard to the preparations, I think the province has done quite well. I mean, when we opened, we were not expecting to not have any form of impact, but the key issue was how do we respond should we find ourselves having such. And yes, the minister is correct. We will operate in this fashion for quite some time until we get a vaccine, where it will be start, stop process. So with regard to just to giving you feedback since then, when we opened on the 8th of June, there were 25 schools that didn't open because of infrastructural challenges. And so up to date, 15 of them managed to open. In terms of infrastructure challenges, there were 67 which had problems with water, and they've all been sorted up to date. In terms of fumigation, that needed to be fumigated from all our schools, we found that it's only 577 that didn't have any capability to really deal with fumigation, but the rest, the 1,752, we managed to allocate them the 15,432 to be able to appoint local capacity to clean the schools. But the 577 Bidvest came through as a donation. I thought I should just repeat it again because there was an assumption that Bidvest was given a contract. No, Bidvest, I can confirm it doesn't have any contract with the Department of Education in Gauteng. So that is as far as the opening. And the vandalism, 331 were vandalized, and we of course were in a process to. Some we've been able to deal with the vandalism, but some have not. So, but in majority, as I've said, is only 25. So in that 25, we did include those who were vandalized. So it was quite a small figure to say those were. So, but in terms of during the learning and teaching process, I must say, we must appreciate the work that is done by our schools. I mean, in terms of managing social distancing and managing and our brigades, well, everyone in the main on how learning and teaching has been proceeding. So far, we have not had any key notable problems. Learning and teaching has been proceeding quite comfortably, and really we are really moving as fast as we could, considering the state that we're operating in terms of the support. I mean, the PPEs and all the sanitizing and all schools have been provided. With regard to school nutrition, everything is according to order. And obviously, during the process of break, there was a change in terms of how that issue will be dealt with. So it will be at different times. So in the main, with learner transport, just to also, with learner transport, currently the province has 212 service providers that are on our database to provide learner transport, and we did increase the allocation so that we can deal with the issues of social distances. But where we don't have a control, and we must be honest on, is on the private aspect, and the minister was quite clear, and I agree with her that it's quite difficult to really manage on how parents are dealing with their own scholar transport, because parents did make arrangement with also private service providers on their own. So in that regard, we are hoping that the Department of Transport and all the other a department or institutions responsible can assist us with regard to compliance. But with the service providers that are on our books, they have complied. We ensure that they should comply, and so far we have not had any fundamental problem. So in the main, everything seems to be going well. One also notable thing I should add is the psychosocial support that has been put in place. You know that the pandemic has really affected not only our physical life, but also emotional and psychological strain. So we have put in place, together with the health department, not only professional health practitioners, but also psychotherapy in place to assist our learners who are struggling to really comprehend the new normal. So with that, I think from the side of Gauteng, everything seems to be in order. All is proceeding correctly. We'll see with the new batch that is coming in how we deal. But as far as things stand, we are more than ready to accept the new cohort. Thank you.
Thank you, Honorable Chilwane. I now invite the KwaZulu-Natal MEC of Basic Education, Honorable Mshengu. Honorable Mshengu.
Thank you, Honorable Chair, and greetings to all honorable members present. Chair, KwaZulu-Natal is the biggest system compared to other provinces. In the province, we have 6,148 schools, 2.8 million learners, and 90,000 educators. That is basically our system as a province of KwaZulu-Natal. And 70%, almost 70% basically of all these schools are in rural areas. And consequently, they are also a microcosm of those communities. So in a community, if there's a challenge of water, if there's a challenge of electricity and all of that, that will be reflected within also the school environment. So some of the problems and challenges that we face as a Department of Education are really problems of communities, which some of them are beyond our scope as Department of Education. But be that as it may, we try by all means to ensure that we continue to provide teaching and learning in an environment that is suitable for teachers as well as the learners. On the 8th of June, we welcomed grade 7s and grade 12s, who constitute 12.7% of the learner population. The grades that are coming back on the 6th of July, they will be constituting 54.1% of the population, learner population, with the remainder coming back in August, constituting 32.2% of the population. Now, of 6,148 schools in the province, we declared 104 schools that were not ready to start with teaching and learning on the 8th of June in the province. And mainly it was because of water and sanitation in the areas of Zululand, Umkhanyakude, Ugu, as well as Utuge. And those are areas in the main that we continue to suffer water scarcity in the province, not only schools, but communities in around those areas. And we have been working hard since then to reduce the number of schools that are not ready, because we committed in the sector that there is no school that is not 100% compliant with the non-negotiables will open in the province of KwaZulu-Natal, in line with the national directive. The students who were affected, or students from those schools, the arrangements we made was that they should be transported into nearby schools that have enough floor space so that they can continue with curriculum. As at yesterday, the report that I got was that there were only 8 schools that were still having challenges to be fully compliant, and we are working throughout to ensure that at least by Monday, all our schools in the province are operational. so that we start now focusing, as in fact, as we have started, on the return of other grades on the 6th. Dealing with schools that are not ready. We should now be dealing with the capacity, and our problem or our headache should be around the capacity of our schools to carry the 54% that is coming back in July. We procured enough PPEs for all the learners, grade 12 and 7s, all the educators, and all the staff complementing our schools. We also procured other essential COVID-19 essentials such as sanitizers and other related things that are enough to last the province for the next 6 months. So from until December, we're expecting no shortages in terms of the COVID-19 essentials in the province. We're now busy procuring the PPEs, masks to be specific, for the grades that are coming back on the 6th of July. And we're working closely with the provincial treasury to run and conclude that particular process. We employed 6,000 screeners as the Department of Education through the EPWP program. The Department of Health in the province has given us an additional capacity of 6,000 CCGs who are also helping us in our schools to be screeners. So in the morning, they will start in our schools. Then once they've completed the process, then they will proceed with the work that they're employed for by the Department of Health. We are experiencing some challenges, or will be experiencing some challenges in some schools that have a higher enrollment as we face in other grades. We are now on engagement to see where can we get other funds to employ more screeners so that there is no delay at the gate because we have 2 screeners or 1 screener at a school. We want to increase our capacity at a gate level to screen so that we don't interfere with the time of teaching and learning, given the fact that we have also lost so much time in that aspect. There were just over 626 schools that were vandalized or that were broken into in the province during the period since the lockdown. And of those, 3 were gutted with fire. And in the 3 schools that were gutted with fire, we were able to provide mobile classrooms that were sufficient for grade 12 and 7. We're working on adding more for the returning grades. In other schools, really, it was a matter of fixing doors, fixing windows and other things that got damaged during the break-ins. Insofar as the challenges of infrastructure are concerned, we're a province, obviously, where there's so much learners that are in our schools, and the infrastructure capacity is quite pressed. And we've obviously made a point to the minister that we are in urgent need for additional funding so that we can procure more mobile classrooms that will assist to maintain the social distancing as we face in other grades. In terms of the timetabling, we are preferring the method of what we call alternative dates or days, where one grade or where other grades will come on a particular day and others will also follow in that fashion. And we believe that will be also helping us to manage the crisis of the floor space and social distancing. Because if we're to bring everyone at once, we're not going to be able to comply with the issues of social distancing. But there are other schools which we've identified in the province that in spite of these timetabling aspects, there will be challenges whereby we therefore need to add more classrooms. The last point, Chair, is around the infections that we have recorded. So far, as at yesterday, we had recorded 133 positive cases. 97 of that 133 is educators, 26 learners, 2 food handlers, 4 security guards, 2 office-based staff, and 1 groundsman. But in all these cases, there is no infection that has happened within the school premises, or there's been no spread of infection within the school premises. All of them happened outside the school premises. But as my colleague in Eastern Cape indicated, they were only found when we're doing our precautionary measures at a level of schools. The very last one is around transport, Chair, and I'm concluding with this one. which is also a problem in the province of KwaZulu-Natal. So far, we're only able to transport 58,000 learners, and in our records, there is an outstanding list of 117,000 learners that are on the waiting list. We're unable to transport them because of the lack of funding. I think, Chair, from the point of KwaZulu-Natal, that's how far we can report.
Thank you, Honorable. Thank you, Honorable Mshengu. The next speaker is Limpopo MEC of Basic Education, Honorable Poshielo. Honorable Poshielo.
Thank you very much, Honorable Chair. In terms of Limpopo, the department has been preparing for the reopening of schools since the day that the schools were closed. The preparations involved the development of all necessary guidelines to be used when schools reopen. And prior to the reopening of school, non-negotiables were provided to guide the preparations, e.g. sanitation, water, screening, cleaning of schools. Chair, we don't have a budget for COVID-19. As a result, the head of department reallocated norms and standard for schooling, whereby 45% is allocated for COVID-19 requirements, excluding the PPEs, which were provided for by the department. The school governing bodies were also mandated to appoint cleaners in line with their requirements. The appointment was done at the time when schools were engaging SGBs and NSNP food handlers to support the cleaning of schools in preparation for the reopening. In Limpopo, 165 schools were affected by burglaries, and the infrastructure official has since been conducting assessment, and majority of schools' door locks were broken, and SGB facilitated the replacement since 26 May, and I can say now all our schools are operational. We have 3,773 schools in Limpopo. On the 8th of June, 3,728 schools opened and 48 did not open. This was mainly because of water and sanitation. But as I'm talking to you now, Chair, all the schools in Limpopo are open and functional. In terms of water supply and sanitation, the Department of Basic Education came in handy, and they are assisting us with the toilets and water tanks. At the moment, all the schools have water supply and the sanitations are done. In terms of managing the COVID-19, we have the standard operating procedures that we are managing together with the Department of Health. We report on a weekly basis to the Provincial Command Council, the Department of Education and Health, in terms of how we are managing them in schools. One of the unfortunate things that we have experienced is that communities and political parties try to close schools where they suspect there's somebody infected in it. But we have addressed it with political parties in the legislature to be able to assist us in this regard. In terms of the COVID-19 cases in Limpopo, educators is 8, learners 4, non-teaching staff 3, so the total is 14. We are managing them in terms of the collective agreement, number 1 of 2020, PSA employees, and then learners in terms of the standard operating procedure. In terms of managing of comorbidities, at the moment we have received 773 applications and 423 concessions have been granted. Many others are coming, but we have noticed that most of them are fake certificates from doctors, and others don't give medical reports, but just write their serious disease, not even explaining what this is all about. So we are subjecting those letters to the Department of Health, where their experts are assisting us. In terms of the implication of the second phase on the 6th of July, Chair, like all other provinces, will have a problem of infrastructure. We would need more classroom, we'll need more sanitation, we'll need more water. We have opted for the rotational method daily, but we don't think that if we don't have enough infrastructure, especially water and sanitation, we will be able to manage. But we are working very hard with the Department of Basic Education to overcome this challenge. One of the good things that our Provincial Command Council have done is to say from now onwards, the executive mayors as the water authorities are the one who are going to report on water provision and sanitation at schools so that we can be able to deal with the issue. The province have provided 2 cloth masks per learner and the teachers, the sanitation, the thermometers, but we need more as we go on and open. We'll need also more screeners and we'll need more food handlers. Scholar transport, yes, we'll need more because of the requirement, and also they must be sanitized and disinfected almost daily. And some of the feeding scheme SMMEs are no longer coping because like in Mashishimale Primary School, where they used to provide for 1,360 learners, they are now providing for only 104. So they are struggling like all other small businesses that are struggling. I think we need to find a way maybe of saying how do we assist them so that they stay afloat. So we are ready for the coming intake as long as we can be assisted with the infrastructure. Thank you very much, Chair.
Thank you, MEC Poshielo. Let me now invite the Mpumalanga MEC of Basic Education, Honorable Machuba. Honorable Machuba.
Thank you very much. Machuba had a letter indicating that she's not able to attend, so that there's an apology. So there's probably an opportunity here to get any other person responsible to take his place.
Thank you, Chairperson. It's
Honorable
Honorable
Chairperson.
Yes.
Yes. Thank
Honorable
you very much.
Shope. Yes.
Thank you very much, Honorable Chair, and greetings to the Minister, Deputy Minister, Honorable MECs, and my colleagues from the province. Chair, the MEC has rendered an apology as indicated that he is not well. So through your permission, I will request the HOD to give us the brief status of the Mpumalanga. Thank you.
HOD.
But this is plenary, Chair.
HOD.
Good afternoon, Honorable Chair, Honorable Minister, Deputy Minister, and Honorable members. I will give a brief summary of what is obtaining in Mpumalanga. First, let me appreciate the opportunity that today we are presenting the status of Mpumalanga in the NCOP. We want first to acknowledge the support that we are receiving from honorable members, the minister, the deputy minister. The deputy minister was also able to come to the province and also galvanize, support from sponsors. What is critical also is we are also getting support from the Honorable Premier in terms of the things that we are supposed to do. As I speak, we got funding through the Finance and Budget Committee for the erection of boreholes in all the affected schools. We also want to acknowledge support that we are receiving from the business community. I can mention just a few Bidvest, and then we also receive support from SASOL. We receive also support from other stakeholders. The list is endless, even from the mines. And the Honorable Chair, you recall that there was a challenge, a school and the media, and then also the mine came to the party to give us the necessary support. We need then to indicate that as a province, currently we have 153 schools which experience burglaries in those particular schools. And we have one fatality where we lost a member of the school governing body during that particular incident. We also want to indicate that there are 15 schools that we have cases of COVID-19, positive cases, and then we have then 8 teachers that are affected and also 6 learners. We need to indicate, Honorable Chair, that as a province, we did have a plan of ensuring that we receive, the learners. First, let me just give a brief summary to say we have 1,815 schools that we are dealing with. And then out of the 1,815 schools, 1,662 are public schools, 18 are public special schools, 132 are independent ordinary schools, and 3 are independent special schools. Then as a province, we have procured the basic hygiene packages, and then we joined the tender or participated in the tender of the Provincial Department of Health. We have procured for the grade 7 and grade 12s, and we are currently receiving, the essentials for the grades that are coming as from the 6th of July. We also need to indicate that with regards to the provision of water and water tanks, we are currently receiving that through Rand Water. There were quite a number of hiccups, but those issues have since been resolved. With regards to also the post-Rand Water interim intervention, we have made arrangements with the different municipalities so that at the end of the day, we are able to provide water throughout the academic year. We also make use of the MRTT, the Mpumalanga Regional Training Trust, where we give artisans and students who completed an opportunity to come and deal with minor maintenance. In this regard, they have also provided drinking fountains and also washing hand basins. 124 schools benefited through the MRTT interventions. We also have an arrangement with our implementing agent, which is then the Department of Public Works, to address infrastructure-related challenges. We've also developed a long-term water provisioning strategy that I'm not going to go through because it might then take time. With regards then to the, because I want to pass the one of infrastructure and then move to the other to say how many schools were disrupted. We have a total of 88 schools that were disrupted. Mainly it was due to water and sanitation challenges. In areas of Kanyamazane and Pinari, it was due to the business community because they were of the view that the local business people should be the one that are being utilized for other, services in those schools. Management of comorbidities, we currently have a data, 221 notices of learners with comorbidities have been received, and then 41 of home education applications. The staff members also, we have issued circulars, and then we have the right number, which is currently 1,531 of those particular educators. Then we need to indicate that we have a database for unemployed educators that will be utilized as substitutes in this particular regard. And then let me then move to the next category to say we have a differentiated timetable that deals with the issues. On curriculum, we are implementing quite a number of strategies. It's the dialect tutor program. We have radio lessons, TV lessons, and we have also subject advisors providing support to a number of learners throughout the province. So what we need to indicate then, Honorable Chair, in closing is to say that we have already started with the provision of the National School Nutrition Program to the learners at home. And then we have also the portfolio of evidence in that regard in terms of learners receiving that. The budget, there is no specific challenge, specific allocation for COVID-19, but we are utilizing savings from the department, the equitable share, for us to be able to address some of the challenges, and also the other grants that are available are also being utilized to address the challenges. That is the summary, Honorable Chair, from the province, and thank you very much.
Thank you, Mr. Nkosi. Let me first ascertain whether MEC of Basic Education from the Northern Cape, Honorable Jack, it's available. Honorable Jack?
Yes, Chair.
It's your turn, Honorable Jack.
Pravir, good afternoon, Chair, Minister, Deputy Minister, Chair of the NCOP and the Deputy Chair, who is my home girl, as well as delegates of the NCOP and colleagues of provinces.
We can't see you.
Can
we have
Open your video.
No, you can't see me.
Open your video.
Thank you, Chair. The Northern Cape, of course, it's a well-known fact. We are the biggest province in terms of land mass, but we are also the scarcely populated province and the smallest in terms of our population. And these are factors that are contributing towards our budget as such. We are reporting here on behalf of 557 schools, 10,000 teachers, 306,000 learners. Of course, if I can start to say the background that I want to give is that on the 8th of June, we welcomed 37,646 learners, that is for grade 7 and grade 12. And that is 12.3% of the total number of learners. And as a matter of fact, we could really manage to get ourselves ready for that period. But subsequent to that, we are going to be welcoming on the 6th of July, 167,000 learners, which will be about 54.6%. And the last cohort will be 101,510 learners, which will be something like 33%. We must also then emphasize the fact that on the 8th, we opened with minor glitches. Those minor glitches being the inability for us to open in the area of Renosterberg as well as Msobomvu area, where Colesberg is, precisely because of
Honorable Jack, unmute your mic.
Yeah, the member must put this video on also.
Also then starting with the process of getting ourselves ready for the second group, which is on the 6th of August. I must also then indicate to say
Honorable Jack. Honorable Jack. Honorable Deputy Chair, can you try to find Honorable Jack?
I will ask Moimang.
Please, Honorable Moimang, can you find Honorable Jack?
Honorable Jack is
hello.
Honorable Jack.
Thank you, Premier. As I've indicated, the Northern Cape is a province that is depending on teachers from the Western Cape, the Eastern Cape, as well as the Free State. And as a result of that, we had some serious problems in some of the schools. That's why some of the schools started later, precisely because some of the teachers had to be isolated because they are from the areas where there's high prevalence. And then what we did, we also worked on identifying teachers that are having some comorbidities, and we guided the process using the SOPs to all schools and to enable the teachers and the principals to identify those people that are suffering from some comorbidities through a circular, and educators with comorbidities were granted concession to teach from home. In other words, virtual teaching is going to take place, as well as some of the teachers that are novice teachers will be supported by the experienced teachers who might be at home at that particular time. Just to gallop further, as the northern conclude. I can't conclude now. Yes. Can I? Okay. Can I then also reflect on the number of educators and learners where we are having some COVID-19 cases? We are having 9 educators, 1 learner, as well as 5 cleaners, as well as screeners that are infected. But out of the 9, 3 recovered, and then 1 passed on from the teachers, and learners is only 1, and then the other cases are still active cases. We are having challenges of infrastructure that we try to address, and that also includes the fact that some of our schools were vandalized during the lockdown period, and we could manage then to get them back to operate. We are also then depending on a process that we are going to follow, that is platooning as well as alternating in terms of weeks. That's why we are going to use the current accommodation that we are having, that is now the current schools that we are having, and we believe we'll be able to manage. On the other matters, I think the only serious challenge that we might be having is to have the additional teachers really appointed, precisely because of the low budget, but we are trying to apply magic to get teachers in order for all classes to have an educator in front of them. With that, Chair, thank you very much.
Thank you. Honorable Jack.
Chair.
I have assigned Honorable Okam, Honorable Christian, Honorable Miemang, and an Honorable Deputy Chair to assist you to make your mic on in the future in our virtual platform. Thank you. The next speaker is the Northwest MEC of Basic Education, Honorable Matsimela.
Thank you very much, Chair. Equally, let me greet all the chairs from the House, greet all honorable members, greet the Minister, the Deputy Minister, all the MECs present here, and the HODs. Honorable Chair, we have accordingly reopened our schools on the 8th of June. Both day scholars and boarders are in our schools, including our special schools. To date, we haven't registered any case of COVID-19 in our boarding schools. And this have shown us that our learners in all our boarding schools across the province of the Northwest are quite safer as compared to day scholars. We have recorded numbers to this far: 40 educators, 15 learners, and 7 staff members from our offices, in our circuit offices, district offices, and also at our provincial level. We have, as a department, managed to discharge a mandate of providing all the essentials in the name of protective essentials, sanitizers in our schools, water and sanitation with the help of both the Department of Water and the Department of Basic Education, because they have been facilitating almost all the necessities that need to be in our different schools. Now, given that we have registered 62 to date, all included educators, learners, and the support staff, every day when numbers are coming, mostly they are coming from our hotspot areas, particularly Matlosana Municipality and Rustenburg Municipality. And the Department of Health have proved to it that the mines are a contributory factor to the surge of COVID-19 around Rustenburg and Matlosana. We had also recorded number of schools, close to 102, that have been vandalized during the lockdown. To date, we have managed to repair all those minor damages, and also those that have been above 50,000, we have taken charge on that as a Department of Education at the provincial level. We have also managed to appoint the screeners that we are calling Marebandwa. In Gauteng, they are calling them the youth brigades. But in the Northwest Province, we are having that Tswana name, Marebandwa, and we believe that the numbers that are there for now can be accordingly managed by Marebandwa. However, we are having a great support of our mines around the Northwest Province that have also provided, especially where they are being hosted, a number of PPEs, and also eager to repair the damages in our schools, and also able to go rent on rent with us moving forward, so that we provide the infrastructure that is accordingly in line with the implementation of the curriculum in the Northwest. So we are having the support of all other stakeholders. We are managing the comorbidities, though the numbers are quite huge. And once the numbers are huge as they are, it says, indeed, moving forward, even if we would want to replace, we will not actually mitigate all those challenges. However, we are having 1,000 that for now we are actually talking to.
Honorable Matsimela. Can you unmute? Honorable Matsimela. We'll get an indication when we're willing to get her online again. Let's move on and invite Honorable Shefa, the Western Cape MEC of Basic Education. Honorable Shefa.
Thank you very much, Chairperson. Can you hear me?
Yes.
Thank you very much. Western Cape, we have, sorry, good afternoon to all of you. If I can be excused from not mentioning specifics, so I don't get into trouble for leaving somebody out, but especially to the chairperson. We have 1,509 schools in the Western Cape and 1.1 about million learners. We have been working extremely hard to get our schools in order for opening, including, of course, first of all, getting the sanitization and hygiene packs ready for schools. We have spent 280 million rand, which we didn't have, of course, on masks and cleaning materials, which includes 2 masks per learner and 2 per government employed teacher in the province. There are over 7,000 non-contact digital thermometers, millions of liters of hand sanitizer, liquid soap, disinfectant, and bleach. We've delivered them in tranches, so not all of the materials were delivered in one go, so because they weren't all needed at the same time. So, but everything will be ready and has been ready for the number of learners who are attending school. All the materials will have been delivered by the end of this month, ready for the 6th of July opening. The money we've had to spend obviously is coming from our education infrastructure grant, because there isn't anywhere else for it to come from, and given yesterday's budget cuts, we are extremely concerned as well about the implications of that on our infrastructure going forward. We have prepared a number of detailed guidelines for our schools in order to assist them in navigating this crisis, including important information from the Department of Health, roles and responsibilities, orientation of staff and learners, screening, cleaning, school feeding, psychosocial support, managing the comorbidities, teachers and learners, safety of learners on learner transport, and hostel safety, how to manage COVID-19 cases in school, and of course the roles and responsibilities of SGB. All our schools were ready to open on the first day. Some weren't open because of the confusion initially, but after that we are obviously facing closures of schools every day depending on infections. So it's a moving target, but usually around about 30 schools per day are closed. We have got a service providers in place to ensure that schools are decontaminated when there is a positive case. And it's generally done extremely quickly. Within a day or 2, schools are ready to go back again. We've been orientating our staff and learners on the important aspects of dealing with COVID, how and why they have to wear a mask, the hygiene processes, screening process, how to behave in the classroom, new physical distancing measures, contact information, how to identify symptoms, and of course what to do when someone has COVID-19. There is a lot of anxiety among parents and learners and teachers, and we are trying very hard to communicate on an ongoing basis, constant awareness campaigns and advocacy about measures to take that will ensure their safety at school. We've developed a screening app for schools, also information on how to screen via guidelines and a video. We also have to obviously deal on a daily basis with COVID positive cases, which is causing anxiety, and people don't always follow the protocol. There is sometimes misunderstanding as to whether a school should have to close completely or not, and it depends on every individual case. It's not, sometimes if a person has only been in a certain part of a school, it doesn't mean the entire school has to close. You can cordon that section off. But obviously if someone has moved around a school and they are positive, then the whole school has to close. But we are relying on our principals to be able to do that and to communicate with parents and teachers every day as to what is happening and what they are doing to ensure that they are safe. Then we obviously also have psychosocial support in place. We have district support teams and school-based support teams as well. We have employee health and wellness toll-free number, also a USSD number and an email for anyone who needs psychosocial support, who is battling with any difficulties, family, finances, whatever. We have been doing meetings also, as you probably know, during lockdown. We put very strict measures in place, but the need was so great that we felt that we just had to contribute to alleviating the hunger in the province. We have served 1.675 million meals from 8th of April to the 8th of June, and it's actually gone very well. And I really want to thank all the people who've assisted us in doing so. Obviously, we have to practice physical distancing. Staff must wash their hands frequently. Utensils must be very well cleaned, and all surfaces must be sterilized straight away. We have about 1,200 applications from teachers with comorbidity at the moment. We also had an indication that would be more, but the ones that have come forward with medical reports are about 1,200. In the meantime, the learners who are not at home, we've done a lot of work on our e-portal, and our curriculum team and learning teams have been really, really fantastic. On our e-portal, we've developed free digital resources, dedicated matric resources. We've got broadcasts on radio and TV, weekly core lessons in every grade, printed worksheets and revision papers, use of textbooks and workbooks, and teacher remote training and a parent. We've even got people to some schools have done like a drive-through in order to get worksheets from the school to go and collect for their children to do at home. Our materials, as I say, will be there by the end of the month. We also asking every school to come up with a plan whereby they will be able to accommodate learners. Obviously, when more learners come back to school, we don't have the space and we don't have the money to have enough additional classrooms and teachers to be able to have them all there and maintain the social distancing requirements. So we're asking every school to come up with a plan. Many of them are doing, sometimes they're incorporating remote learning, sometimes they're doing half a class a day, sometimes they'll do one grade a week. It's up to the school what suits them best. And the majority of our schools have been doing that very well. Obviously we are, because we have sort of been at the forefront of the infections, unfortunately, we have had a number of people who are infected. We've got about, at the latest count, we had just over 700 teachers who had tested positive, but that is since this time we started. It's a cumulative figure. Obviously, some of them will now have recovered, but we don't keep those statistics. We have about 88 learners of those who are back at school who have tested positive, but also, and they were not all necessarily infected at school. Most of them, in fact, were infected before school. Most schools that have reported cases have not been more than one case, which is seeming to indicate to us that the infection is not spreading at schools, which is a good sign. We have had 100 schools that were vandalized that we have fixed. That did not stop them opening, but we had to do some work very quickly in the first 2 weeks before they came back to ensure that they were fixed. As far as we've also interestingly had quite a lot of schools that have applied to the HOD for opening up other grades early. We've had about 161 private schools and 236 government schools who want extra grades to come back before the 6th of July, and that is provided for in the regulations. And then we've had some disruptions by communities. Sanko COSAS is disrupting in Khayelitsha, unfortunately, quite a lot. Some SGBs also are trying to keep schools closed, and we have a few schools where principals also are unfortunately aggravating anxiety instead of alleviating it. So we are dealing with all of those, but I think overall our schools have been doing really well. In the beginning, quite a few learners were nervous. I've visited a few schools and I've spoken to some parents who said their children were quite nervous when they first went back. But after the first day, they've seen how the school's dealing with it and they felt a lot more comfortable. So I think that's a good start, and look forward to welcoming back our learners on the 6th of July. Thank you, Chair.
Thank you, MEC Shaifa. Honorable Matsimela, are you back to conclude? Okay, let's get to Salga Representative Councillor Ngubane. Councillor Ngubane. He was also, I was also informed that he was struggling with a connection. It means it's not back. Then which will make us to move to the next item. Allow me, honorable members, to take this opportunity to invite the Minister of Basic Education, Honorable
Motshega to do her concluding remarks. Honorable Minister, Motshega.
No, thank you very much, Chair. And let me also thank my colleagues from provinces, because we are indeed a team, and most of the inputs they would have given has complemented the report that we gave.
Minister, please. Sorry, Minister, please. Let's have the mic on for purpose of broadcast.
Okay. Okay.
Thank you, Minister.
Chair. No, Chair, thank you very much, Chair. And I think the structure has really helped a lot, the structure of this engagement, because colleagues from provinces would have complemented the report that we gave. And I'm not sure if I really would not be wasting your time to say anything more. What I would have wished to say, I had said in the opening remarks and also in the responses. With your permission, Chair, unless otherwise, I would request that we really leave it at that. And thank you very much for the opportunity, and continue to undertake that if we get the written questions that we are unable to answer because they were specific, and if members feel that even provincial inputs have not responded to their questions, we're more than happy to really also answer in writing. But I want to leave it at that, Chair. Thank you most sincerely for the opportunity.
Thank you, Honorable Minister. Honorable members, it's always an honor when we, honorable members.
Chair, the Councillor Ngubane is here.
Yeah, but already the minister has done concluding remarks. It's not at the end of what we're doing. As we indicated, that there will be some engagements. Sometimes we invite a province, sometimes we invite a minister. So, honorable members, it's always an honor to come together like this and try to do justice instead of making a political game, the challenges facing the country. And we've done justice. It was good, even, Honorable Minister, to extend the invitation to provinces so that we have special delegates to come and complement your team. So as representative of these provinces, we have now a better sense and a better understanding when we understand the challenges, and we see where we can get in to assist the country to move forward in dealing with the challenge that is facing the whole world, the COVID-19 challenge. Allow me now to take this opportunity and invite the Chief Whip of the National Council of Provinces, Honorable Mohai, to do a vote of thanks on behalf of the leadership of the NCOP and the entire membership. Honorable Chief Whip Mohai.
Malibongwe.
Malibongwe. Thank you very much. Thank you very much, House Chair Nyambe, and Chairperson of the Council, the Deputy Chair, and all honorable members and special delegates, Honorable Minister, Minister NG Motshega, and the Deputy Minister, Dr. Mohaule. We have come to the end of the session which reflected on the state of school reopening in the midst of COVID-19 pandemic. And the meeting was important in two essential respects. One, to share information on the challenges of the reopening of the schools in the midst of the pandemic in order to empower ourselves as members of parliament to exercise effective oversight. Also to afford the minister opportunity to get inputs from delegates and provinces on the challenges faced on the ground. As we said before, we are doing this not in a vacuum, but guided by relevant sections, Section 66, subsection 2 of the Constitution, which enjoins the NCOP to require a cabinet minister or a deputy minister or an official in the national executive or provincial executive to attend the meeting of the council or its committees. We are confident that honorable members are empowered through these engagements, and in terms of the direction the department is taking, we are clear on the critical issue of school reopening for the engaging meaningfully with these issues. On this note, we really want to thank the minister, the MECs, and also special delegates for being in this meeting. And I must say upfront, we will at the right time in the council ensure also that when it's necessary, the matter gets debated so that more information is shared or experiences and inputs are given to reinforce the executive. But I must say, the last point, whilst we respect and recognize that members of provincial legislatures are representing provinces, we must always be cautious not to conflict oversight role of the legislature and the role of the MEC who implement policy, and the legislature oversee implementation of that policy. It cannot always be a right for the legislature to become spokesperson of the executive. And on that note, House Chair, thanks very much. And thanks to the Minister for sharing this information once more, for strengthening us to go to our constituency work. Thanks, Yalebo.
Thank you, Comrade Aji, Comrade Regina.
Order, honorable members. Honorable Deputy Chair. Honorable members.
Is it an oversight that you didn't give some?
No, the person
I saw
struggling
them on the speakers list.
No, they struggle to connect, and then at the end, when they're trying to get back. Honorable members, as the Chief Whip has indicated, that at the right time, the House will be able to debate and engage so that we have a better sense as we have done today. Allow me, on behalf of the leadership of the NCOP, by virtue of powers vested on me, to officially adjourn the session. Thank you for your contribution, all of you. The meeting is adjourned.
Thank you,
Chair.
What about Mpumalanga? This is not Mpumalanga, it's National Council of Provinces. You must go for Provincial Week and be there in Mpumalanga.